So, a very warm afternoon to all of you present with us right now. Thank you for joining us in today's session by two great speakers on two different topics. Again, we are back with a new topic and with new speakers. So, I welcome you all to this webinar of today. I, Dr. Yashika Arora, will be the moderator for today's session for all of you. But before we begin, I just want to gist you about the platform of Homeopathy 360. That is an online portal of BGN publishers, as well as I would also like to introduce you to the speakers of the day and the software. For all of you who have joined us for the very first time, I just want to tell you that you have a chat box on your screens wherein you can type your queries and send to us by pressing the button next to the box. So we'll be discussing the question answers at the end of first speaker, and then we'll be discussing the question answers at the end of the second speaker. So you can put your queries in the chat box. We'll be try our level best to solve all your queries. And then I also want to introduce you to the platform of Homeopathy 360. That Homeopathy 360 is an online portal for publication of all kinds of articles, research papers, as well as we have a peer-reviewed journal of homeopathic heritage, wherein you can get your articles peer-reviewed. That's an indexed journal, so you can the articles are invited for the same as and research papers as well. Also, we would like to invite all the esteemed homeopaths who are present with us right now to contribute your expertise, your videos, your presentations, your articles, your course material, anything you want to provide it to the fraternity. You are most welcomed. And also, I would like to thank both the speakers of the day, as well as Mr. Manish Jain, the director of Vision Publishers, who is working for these webinars to provide homeopathic knowledge to the fraternity. So, thank you so much, my team, as well of Homeopathy 360 and Vision, as well as all the whole audience who have joined us for the for today. So, I welcome you all. And now I think it's high time that I should introduce you to the speakers of the day. We have Dr. Furqan Aamer sir from Maharashtra. He has joined us, and his topic of the day would be role of homeopathy as prophylaxis in epidemic. So as we know, this is a COVID-19 pandemic time. So he'll be discussing on many aspects of epidemics. And to introduce him, I am very privileged enough to introduce him. So I would like to introduce him. He's MD Home and PhD Research Fellow from MUHS Nasik, and he has completed his PG Diploma in Public Health and Hospital Administration. Also, he has done his PG Diploma in Clinical Research. He's presently working as the principal of D.K.M.M Homeopathic Medical College, and is located as Dr. Furqan's Speciality Homeopathic Clinic. So he is doing his PhD in the subject of homeopathic materia medica on topic in vitro antibacterial effect of homeopathic medicines. And he has an experience of 18 years as a consulting homeopathic practitioner in the city of Aurangabad, Maharashtra. And he's expert in the operation of all the softwares, as well as he's an expert in selection of the remedy for case with possible positive results and assurance. He's completed his MD in the Department of Materia Medica, and is also working as the principal professor and HOD in the Department of Organon of Medicine at D.K.M.M Homeopathic Medical College, Aurangabad, and is an approved examiner in the subjects from MUHS examination panel, as well as a approved PG teacher in the subject of Organon from CCH and MUHS. He is also the member review board of editorial and scientific publication, MUHS Nasik, and has been appointed as the chief homeopathic consultant at all India level in CCH New Delhi. He is the chairman of Institutional Ethical Committee at D.K.M.M HMC Aurangabad, and is the member of all Maharashtra Homeopathic Medical Colleges Principals Association. He has many other qualifications and has contributed to many publications and articles on the subject of homeopathy in various esteemed journals. And he is the chief of designing, composing, and managing chairperson of D.K.M.M Homeopathic Journal, Gems of Homeopathy, as well as the member and secretary of HAMAI, that is Homeopathic Medical Association of India, Marathwada unit. So we are glad that we have one of the speaker from Aurangabad, Maharashtra, who has joined us today. We have another speaker who has joined us from the city of Punjab, and he will be joining us soon in this today. So we have Dr. Sayyid Tanvir Hussain, sir, who is MD in the Department of Materia, Medica, Organon, and Repertory, all three, as well as a PhD scholar, and has completed his diploma in naturopathy and yoga, also ozone therapy course and a PGT course in anthroposophic mistletoe therapy for cancer from Switzerland. He is the author of the book 50 Millesimal Potency, a silent and showering spring, and as practicing at Ludhiana, at Punjab at Dr. Tanvir's Homeopathic Cancer Care Center, wherein he'll be discussing the today he'll be discussing various of his cancer cases and will be joining us today soon. So now I would like to hand over the session to our first speaker. I hope you are excited to learn from him. So I'll hand over the session to him. Sir, Furqan sir, over to you.
Yeah, thank you very much, Yashika, giving such a brief description or introduction to me. And friends, right now we are facing very much tremendous situation regarding the epidemic situation of COVID-19, and uh, India as well as whole world is suffering with this particular situation, right? In this situation, what we can offer as an homeopath? This is a very important question in front of you. Many of the people are still in the what you can say dilemma, that whether how which remedy should be given, what are the guidelines for epidemic conditions, what are the guidelines for this prescribing of a genus epidemicus. There are so many issues which has been came in front of a homeopath. So likewise, as we have chosen a topic which is a very important one in today's scenario. So I'll try to complete my talk about this, that what we can offer as an homeopath for the uh, prophylactic situation, right? I will give you many of the aspects from the historical perspective, that what we can offer as an homeopath to the present situation, and what is the history of homeopathy, or what is the history of what you can say homeopathic prophylaxis, and what should be the potency or posology should be given while prescribing for prophylaxis. So I'll come from a basic of the few things. As posos is how much and logos is study, the study of minimum dose. So what is dose? Quantity, form and preparation of medicine. Minimum dose, which has been described in all these aphorisms, which I have given to you as a reference: aphorism 3, 246, 275, 280, 283, and 284. Then effect of diminishing the dose, aphorism 285 and footnote. Henman gives the exact definition of dose, which is the fine sugar globules of a size of poppy seeds, one of which embedded with medicine constitute the dose, where contains 300 part of drop, 300 globules weighing 1 grain. So in very sensitive patient, one single olfaction will suffice, as per aphorism 288. The parts susceptible to influence of medicine, 288 and 292. So why I am giving you some background of the dose? Because what I meant, the big question in front of the homeopaths is that how to give the potency in cases of acute condition, in cases of epidemic condition, or even sometimes in cases of chronic disease situation, right? The action of medicine in the liquid form upon the living human body takes place in a penetrating manner with rapidity and universally, and that action is a spirit like action, right? So if we go in detail, improving symptoms are evolving from a pathogenetic dose or pathogenesis. The prophylactic dose is distinct from the curative dose. The curative dose is administered to the organism in an increased susceptible stage. The preventive dose is administered to an organism which is devoid of of the susceptibility to that particular disease situation. So this was a very, very important differentiation between a curative and a preventive dose. You should keep in mind always while prescribing as a preventive medicine. Now coming to the repetition of the dose, aphorism 245 to 251. Repetition depends on the duration of action of remedy, low potency, short acting medicine, high potency, deep acting medicine. So many, these are the aspects, as you know, many of the times you have read several times in the different lectures of Organon and basics of Organon. I'm just giving you a flashback regarding this. Now coming to the prophylactic dosage, that in an epidemic situation, when the epidemic has been prevailed in a particular area, what should be the approach of a homeopath? That's a very important point for us. Because right now, you are seeing the situation that many of the medicines have been failed in front of this COVID-19 situation. Many of the vaccines are also getting failed. Many of the trials of the vaccines are also getting failed. And in this situation, as per the report of Dr. Khurana sir, CCRH, we have seen that thousands or lakhs of people have been benefited by prophylactic of arsenic album in this pandemic situation. So definitely, homeopathy has always given an upper hand when we are talking of prophylaxis. But many of the times we are not able to represent our part, or it may be, remain as a hide sickness or hide fact. So prophylactic dosage, short acting drugs of vegetable origin in lower potencies, 12C or 30 in frequent doses, long acting drugs of mineral in medium potency, 30 or 200 in less frequent doses, and nosodes in higher potencies, 200 and above in infrequent doses. Right? These are the doses of prophylactic. We'll go in the history that how Hahnemann in the different period of time used the homeopathic prophylaxis, and what are the suffering humanity has got benefit from the homeopathic drugs. The idea of prophylaxis first appeared in the article written by Dr. Hahnemann in 1801 named Cure and Prevention of Scarlet Fever by Belladonna. So this was the first article of Hahnemann where you got a very clear cut clue that how Hahnemann used prophylaxis of homeopathy. So July 1799, it is observed that the same remedy given at the period when the symptoms indicative of the invasion of the disease occurs stifles the fever in its very birth. Moreover, it is also efficacious for the after sufferings following the disease. This was written regarding the scarlet fever, that whatever the symptoms are available with the patient, the medicine has been given, and that has prevented the disease situation. During the scarlet fever, the doses given was a single dose of 1 by 432 into 10 raised to 3 of a grain of the extract, and repetition has been done every 72 hours, that is 3 days. Dosage and repetition for scarlet fever as per Hahnemann. See, I have given a very detailed glimpse about it, that how it has been. You can find it in lesser writings. So for children below 1 year, 1 drop. For children 1 year, 2 drops. 2 years, 3 drops. 3 years, 4 drops. 5 to 6 years, 6 to 7 drops. And 9 years, 14 to 16 drops liquid. If the epidemic is very violent, take the second dose 24 hours after the first, and third dose after 36 hours, fourth dose after 48 hours, and thereafter every 72 hours till the end of the disease. This was a very clear-cut direction which has been given by Hahnemann. Now, coming to the next point, cure and prevention of Asiatic cholera. This was the second part which you will find in the history that Hahnemann has used in 1833 Coethen, Germany. In the first stage, at least every 5 minutes, a drop of spirit of camphor made with 1 ounce of camphor to 12 of alcohol on a lump of sugar or in a spoonful of water has been prescribed in cases of Asiatic cholera. In the second stage, 1 or 2 globules of cupramet 30C repeated every hourly. So this was the second what you can say prophylaxis which has been used by Hahnemann. Now, preventive as per Hahnemann in cholera. Once every week, a small globule of cuprum at 30 in the morning, fasting without drinking anything, immediately afterwards till the epidemic lasts. This was the direction given in cases of cholera or Asiatic cholera. Now see, what are the different, where we'll find the literature regarding the preventive medicine with reference to the Organon. Because our mother book is Organon, so definitely we will see the every direction or every, what you can say, suggestions we'll take from the book of Organon. So see here, prevention and proving an analogy. Administration of repeated dose in prevention is analog to the proving. Aphorism 105 to 145 of a drug. Scheduled by Hahnemann, 4 to 6 globules of 30 potency dissolved in water daily and continued for several days. In proving, by repeated doses, we are creating an artificial susceptibility resulting in a dynamic disease in the organism. Hence, in prevention also, repeated doses will enable to increase the susceptibility, thereby enabling the organism to ward off the epidemic. This was the most important sentence which we have to see that how homeopathic medicines help in the prevention of a particular disease situation. So by increasing the susceptibility of a person, we ward off the epidemic. This is a very important aspect when we are talking about that how homeopathy helps in the preventive measures. Now, there shall be some standardization of the dosage in this particular aspect. So, two-third globule of number 2 or 3 globules of number 30 or 40 constitutes a prophylactic dose. Repetition. Views differ according to different authors. A daily or weekly repetition till the duration of epidemic is suggestive. As this has been used during the scarlet fever, Hahnemann had used belladonna in a low potency, approximately 3C for 3 days because of short duration of action. This should be continued till the epidemic lasts. White essay, cure and prevention of scarlet fever, lesser writing, Samuel Hahnemann. You can refer here for more details. So similar case in any epidemic situation, first thing is you have to decide the dose, which Dr. Hahnemann has already given that 3C or 30 potency can also be given. Then the direction is also given that you can repeat daily, weekly, or giving the gap in between of 3 days or 4 days when there is a what you can say prevailing of the epidemic is there in that particular area. For example, if we have seen that Ayush or CCH has recommended arsenic album for the current situation of COVID-19, right? As per the direction of CCRH, this arsenic album 3 doses has been given as a start one, and then it has been repeated after 28 days, right? So this was a scenario where the before the epidemic, this was given the directions when the epidemic was there, but during the epidemic we have to modify some things, and in during the epidemic when the disease is prevailing or there is a containment zone is there, then in that situation little bit modification is there according to the organon of medicine, that you have to give 3 doses for 3 days, Monday, Tuesday, Wednesday, for example, of dose of arsenic album, 1 dose of arsenic album 30, then there will be a gap of 4 days, and then again the medicine will be continued for 3 days, then again there is a gap of 4 days because the disease is already in that particular area or prevailing in that particular area. So this is how the dosage has to be decided on the severity of the disease condition which has been prevailed in a particular area. Then this is also one of the para I have taken from Lesser Writings, page 369. Hahnemann's prophylactic in scarlet fever. A grain of the powder prepared from well-preserved belladonna evaporated at an ordinary temperature in 100 drops of distilled water by rubbing it up in a smaller mortar. Pour this into a 1 ounce bottle, rinse the mortar and pestle with 300 drops of dilute alcohol, 5 parts of water to 1 part of spirit. This is termed as a strong solution of belladonna. You know all these things in the millesimal scale of potency. Coming to the next, 1 drop of this is mixed with 300 drops of dilute alcohol, shaking for 1 minute. This is a medium solution of belladonna. 1 drop plus 200 drops of dilute alcohol, weak solution of belladonna. This can be used as the prophylactic remedy. Each drops of each contain 1 by 24 lakh part of grain of dry belladonna. So this was how the dilution of the medicine has been done, and this is how we have to go with the 50 millesimal potency. Now coming to the diet and regimen, especially in cases of epidemic disease situation. So if you see the last chapters of Organon of medicine, you will find certain diet restrictions has been put up by Hahnemann during the epidemic situation. In that, you have to avoid vegetable acids, sour things, and vinegar. If violent mental depression occurs, give 1 or 2 extra doses of that particular medicine. Then law of dosage by E.M. Hale. If we prescribe a drug for symptoms similar to its primary effect, we must use high potencies. Low doses will aggravate. But if we are treating conditions similar to its secondary effect, we use low attenuation. This is true especially in remedies like aconite, digitalis, and narcotic medicines. Then what Arnold Schultz's law says, large doses of a poisonous substance prove lethal and smaller doses inhibits. Minimal doses of the same poison actually stimulates the vital activities of the same cell. So least action, this is a very important one. What we expect here when we are prescribing a genus epidemicus, the minimum dose we see to stimulate the susceptibility of that particular patient or that particular person. So the quantity of action necessary to effect any change in nature is the least possible. This is a law, universal law. The decisive amount is always a minimum and infinitesimal. The quality of action of a homeopathic remedy is determined by its quantity. Consequently, the law of least action must be acknowledged the posological principles of homeopathy. This is a very important one that either you are without concentrating over the quantity, you should see the quality or fineness of the medicine, or least action required or least quantity of the medicine required to do the action. So this was the scenario where you'll find that many of the times this is a very important one when we see when we are prescribing in cases of prophylaxis. I will give some of the data as I have given you already the data of scarlet fever. Then I'll give some of the big epidemics in which how homeopathy has played a very important role. So I'll give first one is 1833 where epidemic of typhus occurred in Germany, where Hahnemann has used Bryanio and Hyoscyamus and Rostox as prophylaxis, where 183 cases has been treated with no death, not a single death. Then coming to 1820, again of scarlet fever, where 1646 children has been saved by the use of homeopathic medicine by Durjan. Then 1831, again in the cases of cholera, cupramet has helped. You know this very famous one, cupramet for cholera. Then 1831, you also find belladonna against scarlet fever once again. In Persian government, this Persian government has allowed Hahnemann to prescribe this in scarlet fever. This was one of the things. Then coming to the this 1884, Burnett has used thuja for the vaccinosis. This is a very important. This was also a very important. What you can say milestones of prevention in homeopathy. Again, coming to to the latest years of 1907, 1907, Dr. Eaton has used homeopathic medicine for smallpox epidemic, right? Where he has used variolinum on 30,000 people, right? Variolinum 30. So this was also a very much important, what you can say, encouraging data I am having with you to see that how much homeopathy has helped the suffering humanity during the crisis situation. Then in 1932, this 45 children has been saved by Shik disease, which was also prevailed in Peninsula. Then coming to the next about the diphtheria, where experiment has been done with the homeopathy out of 33 children's. You will find out of this 33 children, 20 have got a good results with this. Then in 1950, during the epidemic of poliomyelitis, Dr. Tyler has saved 82 people with homeopathic medicine, Lathyrus sativus. Right, this was a very important remedy, Lathyrus sativus, which has been used for prophylaxis of poliomyelitis and also used for this prophylaxis of this poliomyelitis and also to treat the post effect of poliomyelitis. Right, so this Lathyrus sativus has saved 82 people in that epidemic. Then coming to 1956, East Fielder immunized 6,000 children with homeopathic prophylactic for polio. Again, then we find again in 1963, Gutman has used prophylaxis against 385 people for influenza. Right, the drug was influenza with success rate of 86%. Right, so these were the so many examples which you will find many of the times, or many of the things are there which we can produce, and there is that nothing to say that we are having a role in cases of epidemic. Definitely this will help us, and this data encourages a homeopath to see towards the refinement of the system, towards the prophylactic measures, when the whole world is trying to find out the solution for the disease which the people are or humanity is suffering right now. We are having a very smooth solution for it. Okay, our scholars may say our apex body is saying arsenic album. Some people are saying camphor, some people are saying zinc muriaticum, some people are saying some different. Okay, that is according to their ability. But and what happens, that why the differentiation occurs in homeopathy. I always say in my many lectures, or I always say in most of my lectures, that this prevailing opinions, difference of opinion in homeopathy will remain forever or for many times. There will not occur any standardization. Difference of opinion will be there. The reason behind is that I always say that till the time of Hahnemann's follower was there, but during the history, if you see the history from fifth edition to sixth edition, there was a very big difference of 78 years. Sixth edition was published after the death of 78 years of Dr. Hahnemann, or our master, which has given us the final notation of its final words in the sixth edition. But because of this big gap, what happened, at that time in America, many of the followers are hearing Boning Hassan was there. In Germany or UK, there was the followers of Hahnemann was there. So some people are following this Hahnemann, some people are following this. Some people they are following with the herring, some people are following Hahnemann, some people are following different things. So in this current scenario, we'll find a difference of opinion. But coming to the final conclusion, we will find here that what benefit we can do, whatever the remedy you are selecting as per your ability, or as per your findings, as per your workout with the number of patients. Because we are following the laws of homeopathy, we are following the principles of homeopathy, definitely. So we work out for number of people, we collect the data of number of people, and then come to the conclusion of genus epidemicus. So definitely everyone is following the rule, right? But there are little bit confusion which occurs in between the people, that some people they think that the remedies which are useful for management can also be useful for prophylactic, but there are different stages of remedies are there. Some are useful for preventive purpose only, and some are useful beyond the prevention. When disease occur, then they are the part of the management, and these remedies are useful at that stage only. So definitely we can give a upper hand. And many of the data, if you see, go over the net or Google, you will find many of the data are there available, where we can find there are so many data from which I have started from 1813 or 1820. You will get the full data till 2019, right? All data is available over the net. You can see that how in various situations of epidemic, how homeopathy has helped. And definitely in future we'll give a upper hand, because thousands of rupees are getting invested over the management part, but in spite of that we are finding that very few remedies are, or very few line of treatments are getting success in the patients with comorbidity and all these things. So our work is that to go through the mother literature first and then follow that. That is an important one. Okay, our apex bodies are suggesting us remedies, our apex bodies are working over it, and they are suggesting us remedies, but definitely you have to finally take the help of your mother literature, that what Hahnemann has said in the Organon of medicine, that are the final words for us. So definitely these are the things which are important to work out during the epidemic situations. So I think this will be a sufficient one. Whatever the what you can say, the regarding the genus epidemicus, right now I have already told you that arsenic album was given by the CCRH. Then so many other prophylaxis are also given in the direction of Ayush. There was Rostov, Bryony, and this Belladonna was also given in the line of management. So definitely this will help us try to solve the problems of suffering humanity, because the real pleasure of a physician is that giving a real uh, cure to the suffering humanity, or to ease the difficulties of suffering humanity. That is a real pleasure, and that is a real duty of a physician. So definitely I think that in a very cost saving way we can help the suffering people with homeopathy, right? So I thought most of the things has been covered. If anybody is having any question, then you can ask me. Yes. So there was a question that
Thank
which
you.
remedies mother tincture should be used in this COVID situation. See,
Yes, sir.
right now there is no need of mother tincture, because we have worked out so many cases after the direction of Ayush also. We have worked out so many cases and find that the totality of symptom what a presenting with the suspicious cases of COVID is there, that is totally suiting to the arsenic album. And we are having a track rate of record of 95% of our clinics also, that is a definitely a positive hand. So I think there is no remedy which is having such a good effect like that of arsenic album 30, which is a booming effect to all the COVID situation present right now. Anything else?
Thank you so much, sir. Yes, there was a question before also. Um, there was a question from Dr. Tusharika Sharma.
Mm-hmm.
What will be the duration?
See, I have already told you while giving a briefing regarding the prescription of prophylactic medicine. What I thought, or what is my experience, I want to share with you, that what CCRH has given, that 3 doses are given of arsenic album, and that should be repeated after 28 days, right? That was one of the direction. But in my view, that was the primary way. That was at the time of when there was just starting of the before the epidemic situation. But right now we are in a situation of prevailing epidemic. Already this epidemic has been spread and coming to our houses. So right now this scenario has been changed. And according to Dr. Hanneman, when there is a prevailing of the epidemic is there in front of you, your direction of dosage will be changed. And the change is that what I have told you, that 3 days medication. For example, Monday, Tuesday, Wednesday, right? You have to give one single dose of medicine. Arsenic album 31 dose Monday, one dose Tuesday, and one dose Wednesday. Then Thursday, Friday, and Saturday, Sunday, you have to give break. Again, you start from Monday. Monday, Tuesday, Wednesday. 3 days medicine is given, and again there is a break of 4 days. This should be continued till there is a containment zone. There is a prevalence of the disease in your particular area is there. Second thing is that you have to stop the medicine when you are getting the symptoms or proving of that medicine. Means few of the symptoms are there which in front of you. Uh, Means some of the symptoms are there which are there of arsenic album. You are getting that. Then you have to stop the medicine for 1 week or 2 weeks, and then you have to go ahead. Right, again with the same pattern. Right. So one of the question is that other than arsenic album, what are the other drugs which can be used during COVID pandemic? This is a very nice question. Apart from arsenic album, what I thought, there are 4 or 5 remedies which I have used several times. Belladonna is there, Trustox is there, Brania is there, Drosera is there, and Antim Tart is there when there is a most of the respiratory symptoms are there. So these, and also you see in the direction of Ayush or CCRH also, these are the 3 remedies is, has been given: Belladonna, Brania, and Rustox. I have added Antim Tart and Drosera because the presenting complaints here are dry cough, right, in the beginning. Right now, many of the pictures have been changed. Then, medicine for boosting our immunity to fight with COVID pandemic. This is again same. Our role is same. Definitely, Masroor, your spongia is also a good suggestion, but it required in rare cases because the dry cough which is happening is a more of a type of bryonia as that of spongia. Anything else?
So there was a question from Dr. Praful. He wanted to know about genus Epidemicus.
Right now is arsenic album, definitely.
So I would like to request the audience to please put up your questions if you still have any queries. So we'll discuss them.
This Priyanka Jibyankar, I want to know that you have told that what is the role of camphor. So my opinion may differ from other people, but I, as far as myself is concerned, I thought that this camphor is more part of a management as compared to the prophylaxis. It is more of a management part remedy. It's not a prophylactic part remedy. Okay, but different schools of thinking, they are telling different findings they are having, so they are suggesting that. Sankaran sir has given camphor. I have seen, and we are also having a proposal here in D.K.M.M of prophylactic distribution of camphor. We have tie up with Sankaran sir. Definitely, within a few days we will start that. So role of camphor, definitely when our studies will come, then my trust will be there. Till that, myself, my thought is that it is more of a management part. Yes, anything else?
So one more question. Please suggest medicine avoiding post-COVID-19 complications.
Yes, this is a good question. We have find many of the people who, uh, before that, I want to tell you that whatever the patients I have myself distributed more than 10,000 arsenic album, out of which we have got 95% what you can say preventive rate, right? This is a very grand success. Then our friends have also distributed 5 to 10,000. Then they have also got 90% to 95% what you can say success with the arsenic album, right? Coming to the post complications or difficulties, most of the time the patient is presenting with the dyspnea, weakness. These are the most important what you can say prodromal stage or last stage of this disease is there when there occur a recovery. So definitely there is occurring so many complaints. Most of the general malaise, weakness are there. patient cannot do the work, patient is having dyspnea on slight exertion, so many other things are coming up. So in this situation, why I thought that we have to see the remedies which are useful in post disease conditions like typhoid or like this. So we are having China, carbovage, acid phos. These are the remedies which are used in the post cases. And by seeing the weakness of the people of COVID-19, I have found useful two remedies here, China and carbovage. These are the two remedies which I have found very useful for recovery from post-COVID. And definitely that has given very good results. Anything else?
Yes, sir. Thank you so much. One more question. They want to know. Uh, Wait, I'll just is aspidosperma. I think aspidosperma. He's writing mother tincture useful.
No, I don't say. I have not read summary at this one.
Okay.
So
So
I
one
can't say
more
about that.
question.
I have to see that
So
because
what to
I
do?
very rarely see in my view, mother tinctures are having a very short acting results. So definitely we don't prefer mother tincture, right? We always use the medicines which are dynamic medicines and that gives lasting results, right? Mother tinctures are having a very much effect like that of allopathic medicines. That you're given a medicine and that has stopped the complaints. Again, stop the medicine, the complaints started. That was a situation which we have observed while prescribing mother tincture, right?
Thank you, sir. One more question. What to do for solving the problem of loss of smell? Anosmia.
Anosmia, you have to see whatever the line of treatment we suggest in homeopathy, that is depend upon the number of cases, work out over the number of cases, right? 100 cases or 200 cases or 50 cases having similar complaint, depending on that we prescribe a particular epidemic or genus epidemicus. That is our criteria. But these are the cases right now coming of COVID-19, which is having a GIT complaints, is loss of smell, loss of taste. These are now the presentation of the COVID-19. So definitely we have to work out for current situation. And some cases may be there. What homeopathy thinks that every case is different, definitely. But in this situation, we think of these cases are different and we have to treat accordingly. The remedies maybe are nitromur are there, pulsatilla are there for anosmia, so many other drugs are there. So their totality can be compared with that particular remedies and that particular remedies can be given or tried, right?
Thank you so much, sir. I think one last question we have from Dr. Durgesh. He want to discuss a case. He had taken camphor 1M as prophylactic because his father and mother was suffering, infected, I think. And
Definitely. Definitely, I am
but
reading that question. I am
yeah,
reading
but
that
that
question. So similar situation occurred in Bajaj. I am not against anybody or any thought of school. First of all, I want to tell you that I am a strict follower of Organon. I don't follow any school of thought. That I want to clear. Because sometimes what happens when we comment over somebody's selection, then there happens that these people maybe are against someone, right? So I want to clear one thing is here that I am a strict follower of Hahnemann. Whatever Hahnemann has said, that's the last words for me. That I thought. Then definitely coming to the part of this camphor, this was similar situation which happens in the Bajaj Auto Limited Aurangabad, where 3,000 people has been given camphor, and afterwards it has found that more than 600 to 700 people has been affected with the disease condition. So definitely we should now not have. We are not commenting anybody or anybody's suggestion, but what I want to say, work out from yourself. That is the most important. Okay, whatever the guideline people are giving or whatever the guideline the institutes are giving, that are only guidelines, that are not the final words. After all, when you will sit in front of your patient, when you will experience the things that matters. You see, when you start reading the books of Talks on Classical Homeopathy by George Whittlescott, on the first page of preface he has written that stop writing the literature in homeopathy. The literature is so scattered that it cannot be this access easily. That was the sentences which has been used by George Whittlesey. So similar thing I will tell you here, that in this situation also, that work out the patient. Anybody can take out. These are not the final words. Anybody can take out. The direction is with you. Direction is with you. Hanneman's direction is with you, that how to select the genus Epidemicus, and definitely you follow that direction. Take a 50 sample of 50 patients, take their common symptoms and take out the case and find out the final remedy. So nobody's words are final. Pictures are changing, virus strains are changing day by day, the complaints of the people are changing. So definitely our remedy should also be changed, right? Because you see, this was the first time in the history of medicine that I am seeing that daily there is an update over the website of WHO. Daily there is an update of on Ministry of Health, that line of treatment are continuously changing in the allopathy. So definitely in homeopathy also, as the picture are changing, as the complaints are, new complaints are coming in front of you, definitely you have to work out over it, and you have to think that our remedy picture will also change, right? Anything
Thank you
else?
so much, sir.
This loss of smell and
Sir,
taste, I
there
have
are
told you already, nitromur and pulsatil.
okay. And does
Two
tuberculinum have a
remedies are
role in COVID?
nitromur and pulsatilla for anything. Yeah.
Tuberculinum's role in COVID.
Of,
Tuberculinum's role in
I'm not getting
COVID-19.
your question.
Sir, tuberculinum's role in COVID-19.
See, tuberculosis. Yeah. Definitely, this is a later part remedy. This is not a start remedy. This is a later part. In the management part, you can take the help of tuberculinum, because there are this remedy is more having effect. Sorry, this virus is having more effect over the respiratory system. So definitely, we are having a good picture of tuberculinum. We are finding in some people. So definitely, it has a good results. Yes. Anything else?
Thank you so much, sir. I think all of the doubts are being cleared very well. And I want to thank you for taking out time from your busy schedule to guide the students as well as practitioners regarding this topic. Thank you so much, sir. I personally admire you so much and I have learned a lot from you during my post graduation, and everything I've learned from you. So I seriously enjoyed the session personally, and I hope everybody who have joined us today who enjoyed the session. We are getting comments
Thank
also
you very much.
in the chat box. So thank you so much, sir.
Yeah.
Uh,
Yeah.
there is another question: having a minor chest pain from Dr. Durgesh. What to do when the patient is having a minor chest pain? Hello, hello, sir.
See, there is a what we can say with all these symptom. Only a symptom we can decide now a remedy, right? You have to see the totality of symptom what is there, and definitely after passing this first stage of COVID-19, you have to see what are the changes are happening, because the next changes are occurring very fast, right? Suddenly the saturation of the people are getting down. Suddenly the people are this getting into means within no time these people are getting deteriorated. Either it may be means as far as, for example, I'll tell you that as far as my city is concerned, I have seen all over India most of the deaths are above 60, but in my Aurangabad maximum deaths are from 35 to 45 years. So definitely pictures are changing, virus strains are changing, and in this changing scenario, we don't have to take this lightly. Anything which is going deteriorating the pathology is going on. Definitely, you go to the higher center. Don't be remain with the obsession or with your assumption that homeopathy will treat and everything will be all right? You don't have to take risk. As soon as you are seeing that pathology is going on, this is cycle. See, Herring's law of cure. That is important one you should put in front of you. That whatever the things are getting deteriorated, as soon as it getting deteriorated, you consult to a higher center and definitely go for its treatment. Don't try to in the what you can say that when the pathology is going on deeper and deeper, don't try to homeopathy because this disease is not giving time to us. And in this situation, I am telling you very frankly that we have lost so many good people, so many good physicians, senior physicians in front of us. Either it may be from a homeopathy side, either it may be from a allopathy side. All over the world, we have lost a very giant peoples of medicine, and this is very painful to us when see these people that they have so many years of life they have spent it to the service of humanity or to the suffering humanity, and suddenly they have died. So we don't have. I don't think that you should believe that when the pathology is going down, your position is going down. So don't be uh, remain seated over homeopathy. Go to the higher center and start treatment. That I will say. Definitely, with this you can give homeopathic medicine, no doubt. But when the pathology is going beyond, you directly go to the higher center. That will be my suggestion. Yes.
Thank you so much, sir. I hope everybody's queries were being cleared. Still, you have any queries, you can mail us at webinar@homeopathy360.com. We'll be connecting you to the speaker and try to solve all your queries. And we'll be discussing. So, thank you so much, sir, for your contribution today. And such a nice presentation and panel discussion.
Thank you.
Thank you so much, sir.
Thank you very much. Thank you.
So we have our second speaker, Dr. Tanvir Hussain sir, also who have joined us now. So I just want to request, sir, uh, sir, please
आप
on
बोलो
your
पकड़ो
audio and video.
आदमी होना थोड़ा रुक जाए
Thank you so much, sir. Thank you. You are absolutely visible.
Oh,
So
thank you,
thank you
Dr.
so
Tanvir.
much. Sir, he's Dr. Mohammed Furqan, sir, from
Hello,
Aurangabad.
Assalamu alaikum, Doctor.
He's the principal of D.K.M.M Homeopathic Medical College. Yes, sir.
Assalamu alaikum, Doctor.
Thank you so much, sir. So I think everybody has enjoyed, and now it's time that I should introduce you to the second speaker of the day. We have Dr. Tanvir Hussain, sir. He is MD in the Department of Materia, Medica, Organon, and Repertory, and also a PhD scholar. He has completed his diploma in naturopathy and yoga, and has also completed his naturopathy course, ozone therapy course, and postgraduate training course in anthroposcopic mistletoe therapy for cancer from Switzerland. He is the author of 50 Millesimal Potency, a silent and showering spring book, and is a chief consultant at Dr. Tanvir's Homeopathic Cancer Care Center and a visiting professor at Lord Mahavira Homeopathic Medical College, Ludhiana. He is the president of Homeopathic Study Circle Punjab and is the lifetime member of various national and international homeopathic associations, director of National Homeopathic Mission of IEHP for Homeopathic Education Quality Improvement Program, and he has enjoyed the prestigious posts like National Secretary General of IEHP, National Vice President of IEHP. He has presented papers internationally as well as nationally in almost every state of India, and had the honor to present the paper on homeopathic management of cancer cases at AIMS New Delhi as an invited speaker. He's the recipient of so many awards like Dr. Hahnemann Memorial Award, Dr. Borix Award, Avantika Dhanvantri Seva Saman 2013, Dr. James Tyler Kent Award 2015, Dr. Divan Harish Chand Memorial Award 2017, and numerous awards. There are I can only name a few. There are more than 25, 30 awards he's achieved, and many more not added here. So yeah, I just want many of these speakers comment about him that he is the Sachin Tendulkar of homeopathy, like Dr. L.M. Khan, sir, the former director of National Institute of Homeopathy, Kolkata, has very well said him as Dr. Tanvir is the Sachin Tendulkar of homeopathy, and he's a very young, dynamic academician who has unquenchable thirst for the knowledge of homeopathy, as said by Dr. S.P.S. Bakshi, sir, who is the CMD of Vaccine Group. So we are glad that he has joined us on the platform of Homeopathy 360. And me myself is a big fan of him. So he has a good fan following, I would say. So we are glad to have him here. Sir, welcome to the platform, and I would hand over the session to you now to discuss about the cancer cases.
Thank you very much, Dr. Yashika. Shall I share my screen now?
Yes, you can share your screen. There is an option on the screen wherein you have on the audio and video, no? So there is the third option of turn screen share on.
I have turned my screen share on, and it
Okay,
is.
so now yes, sir. Now it's visible. You can open your PPT.
So there are a lot many things have opened up now.
No, it's okay. You just open your yes, sir. Your
This
PPT
is
is now
visible.
visible. Now only
Okay.
your PPT is visible. Please keep it full screen.
Okay.
Yeah, sir.
Is it okay
Thank you
now?
so much. Yes, sir. Perfectly fine. Thank you.
But I have gone somewhere. I am not able to look myself, Yashika,
Sir,
here.
I understand because of the
Okay.
screen share. Screen share,
Okay.
that's
Okay.
that's
Okay.
the issue. You are visible to us. You're visible to
Okay.
us.
Thank you very much. Thank you so much for this nice introduction, Dr. Yashika. Still, I am the student of homeopathy. First of all, I would like to congratulate my co-speaker, Dr. Mohammed Furqan, Aamer Sahab, who has wonderfully explained about the role of homeopathy as prophylaxis in epidemics. Congratulations, Dr. Sahab, and Assalamu alaikum to you. Good afternoon, everybody who have joined me in this wonderful session of 360. Now we will take up a journey of homeopathic management of cancer cases now. Friends, I will share few of my cases from my practice. First case I will go with is about a case of chronic myeloid leukemia with acute exacerbation. This is a place where I practice here. This is my cancer care center, Dr. Tanvir's Homeopathic Cancer Care Center in Punjab, in Ludhiana. Near Ludhiana, there is a small town, Maler Kotla. Here I am practicing since 1996. So directly we will go to this topic regarding this leukemias. The introduction is leukemias are malignant disorders of the hematopoietic stem cell compartment, characteristically associated with increased numbers of white cells in the bone marrow and or peripheral blood. This is the lineage of this blood cells. I will not go into this in detail because I will directly want to go to the case. Now, what is the clinical presentation of CML? Chronic myeloid leukemia, if you see the common symptoms patient presents with are fatigue, weight loss, anorexia, abdominal fullness, and the common signs are palpable splenomegaly, and common laboratory findings are abnormal differential anemia, leukocytosis, thrombocytosis, and basophilia. Now, if we look at this clinical course or phases of CML, we can say that patient first get chronic phase, which is having 5 to 6 years stabilization. After that, patient goes into advanced phases, which is divided again into two classes. Number one is accelerated phase. Once patient gets into accelerated phase of chronic myeloid leukemia, his survival is only 6 to 9 months. But if one gets enter into blast crisis phase, then median survival is only 3 to 6 months. So this is the clinical course of CML, where from chronic phase patient enters into accelerated phase and then into blast crisis phase. These are the laboratory parameters. I will skip these things for. Now, how we are getting diagnosed? It is accidentally we are getting diagnosed on routine WBC test shows elevated leukocytes. Then it is confirmed with bone marrow biopsy and fish panel or PCR that shows presence of Philadelphia chromosomes. Now, these are the staging of CML. I have already explained you. It is from chronic phase to accelerated phase to blast crisis phase. Now, coming to the case directly, this is a case of Mr. X, 27 years old male. He is a married person, businessman from Ludhiana only. The case was taken on 1st January 2013. Now, the chief complaints with which patient was presented, number one was thrombocytopenia since about a year. Number 2, apathy mouth, off and on since about a year. Number 3, swelling face, especially around eyes, which gets aggravated on the side patient leans on. Friends, there is one story behind this case. In the evening of 31st of December 2012, I received a phone call from one of my patients who informed me about this patient and said, Doctor, one of my colleague, one of my friend, he is in cancer hospital in Ludhiana since last 10 days. In spite of all the treatments of the hospital, the conventional treatment of the hospital, his platelets counts are not coming up. Rather, on the contrary, they are falling regularly. So, can you help this patient with some your homeopathic treatment? I said, okay, I can come to Oswald Cancer Hospital and can see this. But those people, they told me, doctor, we are getting discharged from here because we have spent all of our money. Even the house of the patient was sold out because of these expenses of the hospital. So he said that we are coming to you. Then this patient was brought to me on 1st of January 2013, and he presented only these 3 symptoms to me. Because he came to me directly from the allopathic hands, and all of the symptoms or most of the PQRS symptoms of the patient, they were all subsided because of massive allopathic drugs. And number 2, because of this advanced case, this patient's vital force was too weak to throw out the PQRS symptoms in this case at this point of time when he came to me. Now, what is the approach to such cases? What to do further? Then I requested Dr. Samuel Honeyman, sir, please guide me. I opened my Organon. Dr. Honeyman guides us in 91 aphorism of 6th edition of Organon. He says, the symptoms and feelings of the patient during a previous course of medicine do not furnish the pure picture of the disease. But on the other hand, those symptoms and ailments which he suffered from before the use of the medicines or after they had been discontinued for several days give the true fundamental idea of the original form of the disease, and these especially the physician must take note of. As very rightly Dr. Furqan Sahab has said that he follows Hahnemann. Friends, whenever I get any problem in my clinical practice, I always knock the door of Dr. Samuel Hahnemann, and he says, open this Organon. Everything as I have written in the book. Please go and read this again and again. So in this case, according to 91 aphorism, I need to note down to inquire about those symptoms which were there with the patient before the allopathic treatment if possible. And if it is not possible to note down those symptoms, Dr. Hahnemann says you send the patient for 15 days or 20 days with placebo so that his original symptoms should come back. But in this case, which is already sinking regularly, daily his platelet counts are going down. I cannot send the patient with only placebo because I don't have any much time to send him. So in the very next aphorism, in 92 aphorism, Dr. Hahnemann says, when the case is so serious or in emergency, then you can make a combined picture of the totality, whereby the symptoms of the patient and of the treatment, they will be there, and you have to prescribe on those symptoms. So I started inquiring about the history of chief complaints. Patient told me that he got married in May 2011 and was fit and fine until beginning of July or August, when he got fever, for which he took allopathic treatment and got better. Again, after 1 week, he got fever and again he took allopathic treatment. Again, he got better. This happened 3 to 4 times. And on his complete blood count, he got increased TLC. Then he went to Ludhiana Medical College, which is a very famous hospital in Ludhiana, and got diagnosed as a case of CML in August 2011. His oncologist put him on imatinib Gleevec 400 mg. Friends, this is the drug of choice in conventional medicine. Whenever they get any CML case in chronic phase, they start this medicine. This is the drug of choice in conventional treatment. And he was getting off and on relief with this. Most of his symptoms, they were better with this imatinib Gleevec 400 mg. This is the diagnosis of CML from the LAL path, which shows chronic myeloproliferative neoplasm. This is the diagnosis of CML with acute febrile illness with mucositis. This diagnosis was made from DMC, the Anand Medical College, Ludhiana. Now, in the first week of May 2012, again he got fever after attending one Jagrata at night. During fever, his face was reddish. He lied down because of tiredness. He had pain in the legs. He slept there and perspired profusely. Friends, I am just taking the history of 2012. So he slept there and perspires profusely. And in those days, he used to lie down much of the time without eating or drinking anything or very little at all. The whole family was tensed with this. He again got admitted in DMC for it. He took treatment from DMC for about 8 to 9 months and was doing fine for about 6 months with that. This is the report of the lab, where on 2nd of May 2012, his WBC went up to 40,000, more than 40,000, and platelets dropped down to 32,000. This is the time for the shock to the patient. In November 2012, his oncologist told to his wife that this patient will not survive for more than 1 to 2 months because this patient had entered into accelerated phase. From the chronic phase, he entered into accelerated phase. That time also was almost up. His wife got shocked and went to another hospital, Oswal Cancer Hospital, to take another opinion. He got admitted in Oswal on 7th of December 2012 with 104 fever, swollen face, and apathy in the mouth. And he was discharged on 17th December after 10 days in a stable condition. But on 8th December, he took bath and got exposure to cold air. Friends, you know the winter of northern India, particularly of Punjab, is very, very cold. You can see the time. It was December 18 when he got exposure to cold air after taking bath, and again he got fever and vomiting, therefore got admitted again on 21st December 2012. He had severe body pains. His platelets count was 27,000 that time. His legs pain was intolerable to him, especially on walking, causing him sleeplessness and better by massage. The taste of the mouth became flat during fever. He was given 5 SDPs, that is single donor platelets, in these last 10 days in that cancer hospital. But now today his platelet count was just 12,000 only. Yesterday it was 20,000, but after SDP it decreased to 12,000. These are the investigations which were done in cancer hospital in last 10 days. You can see the HB, TLC, platelet count, and basophils. Now at this point of time, even the basophils started coming up. You can see the number, and most of the days you can look at the screen, at the slide, that his report on 21st December 12, in the morning it was 27,000, in the evening it was 22,000. Again, you can see the very next day platelet again down on the very next day it was 15,000. Again he was given and it went up to 37,000. You can see HB is also very low, 6.8 only. And TLC you can see 71, that is normal. Now again you can see the date wise all the investigations. By the time he came to me on 1st of January 2013, you can see the last line of the slide, whereby his HB was 7.9, TLC was quite low. You can very well imagine the immunity of this patient. Platelet count was only 12,000 with basophils 18 in number. Now friends, it is very critical condition for me also. It is not so easy to handle such a case because of this, the reports you can see. And the time which was given to this patient by one renowned oncologist of Northern India, that was also up by 31st of December. Now whatever time we could grab, it would be only a grace period for this patient, because he was already into accelerated phase. Now patient as a person, appetite of this patient was decreased from 4 to 1 chapati, 4 roti to 1 roti he was taking nowadays. And thirst. Friends, I want your kind attention here. whenever we are asking about the thirst, particularly regarding fever, we should ask about the thirst in particular stage of fever. For example, in this case, you can see that he is thirstless during heat stage of fever, but during sweating stage, he is more thirsty. Especially when he does not have fever, he is more thirsty. Regarding the desires and aversions, he does not eat anything except tea and biscuit in fever. And regarding this history of tobacco, he had chewing for 8 years and sometimes opium husk also. And these things, the tobacco, opium, all the narcotics, they are kind of fuel to the fire in cancer cases. They are one of the exciting causes also. Now, the stools, he is usually constipated and goes to the toilet on alternate days because he is not eating much. He gets diarrhea if he takes eggs, cheese, or spicy food. Urine is normal according to water intake. Sleep, during fever, he becomes restless due to pain in the body, especially in the legs, and therefore cannot sleep due to this. He wants his legs to be massaged and then he feels better. Dreams are nothing specific. Thermals, he cannot tolerate cold weather. He even has tendency to take cold easily. Perspiration, he perspires profusely during sleep at night, but he can't sleep if his undergarments are wet. So he changes his clothes 4 to 5 times at night. You can see, you can imagine the quantity of sweating. It was like a drenching sweat because he had to change his clothes 4 to 5 times at night because of this wetting of the clothes with sweating. Mental journals, during fever, he wants to lie down. He does not want to talk to anybody and gets irritable, especially if someone disturbs him. His wife told that we are living with patient's brother, but his brother ignored him very much. Patient misses his mother very much and sometimes weeps also. This patient was orphan because his parents, they were no more with him, and this patient was living with one of his brother, but brother was ignoring him intentionally. Why? Because if he would give attention to the patient, then he would have to bear the treatment charges, and he had to spend a lot of time, money, and energy with this patient. So he was ignoring his patient brother. General examination, since May 2012, he has lost about 10 kg weight. Now he is 50 kilogram with 5.7 height. Past history is nothing specific, and family history. His mother died of heart attack 8 years back, and father died of asthma 20 years back when this patient was only 6 or 7 years old. Now it was a pseudosyphilitic miasm, we can very well imagine. Now, defining the problem. Friends, when we take up the complete history of the patient, we have to define the problem. As Dr. Honeyman is giving instructions to us in aphorism number 3 of 6th edition of Organon, because physician must need to know what is to be cured in the case. What is to be cured in the case. So this is the problem with me, and I need a medicine for a pale, anemic, and chilly patient with pumped out constitution, with excessive weakness after fever, fever which comes after exposure to cold air and after exertion, which causes severe pain in the lower limbs and prevents him from sleeping. Patient who is thirstless during heat stage but thirsty in sweating stage and during apyrexia. I need a medicine for a patient who perspires profusely at night during sleep and is diagnosed with chronic myeloid leukemia. So this was the problem, I have to solve it. Now the next point is classification and evaluation of the symptoms. Friends, whenever we are taking a chronic case, we should go to the different titles as if I'm showing you. So we have to define the problem. Next one is classification and evaluation of the symptoms. So we have to see what kind of symptoms we are able to get from the patient. For example, in this case, we have divided the symptoms into 3 categories. One is qualified mentals, number 2 is physical journals, number 3 are particulars. Now these qualified mentals, we got aversion to being disturbed during the fever stage, grief about missing his parents, he gets irritable when disturbed, and he is restless during fever, and he has aversion to being touched. These are the qualified mentals. And as far as physical journals are concerned, we have thirst during perspiration, thirst during apyrexia, thirstless during fever, sleeplessness from pain in the limbs, severe fever after exertion, perspiration profuse at night during sleep, tendency to take cold easily, vital heat lack of leukemia, allopathic medicines abuse of excessive weakness, weakness after fever. These were all physical generals. And if we go to the particulars, we have swelling around the eyes, pain extremities, which is better by pressure, pain in the lower extremities aggravates during fever. So all these are plethora of symptoms I was able to get. Whatever information I was able to draw from the patient, I have put up here. Now we have to select the repertory, because the type of case will only decide which repertory would be better for this case. As the case has many qualified mentals and physical generals with few particulars, so synthesis repertory, which is the expanded version of Kent's repertory, would be the best for repertorization. So after evaluation of the symptoms, we have to convert the symptoms into rubrics. So I have converted all the symptoms into these rubrics. Now, see, all these rubrics are not important for repertorization because there are many. So we have to be little more choosy. We have to see most important symptoms which should contain our medicine. So the next point is selection of the rubrics. In the whole case, if you look at the complete symptoms here in the back slide, you would find that many symptoms are looking very common. But there is some important symptom. You can see the important symptom, which is of leukemia also. Profuse sweating is a symptom of leukemia. But if it is marked with modality, then it is something very PQRS for us, because it covers the symptoms of the disease as well as of the patient if it is marked with the modalities. So if you see here, symptom number 6, perspiration profuse at night during sleep. I need my medicine which should cover this symptom. It is a general symptom, it is a qualified general symptom, and it is something very, very core of the patient in this case. So I made this symptom as an eliminating rubric: perspiration profuse at night, sleep during aggravation. I have taken only these 10 symptoms into consideration: disturbed aversion to being, thirst during perspiration, thirstless during heat, fever exertion after, because whenever he gets exerted, he gets fever. He's a chilly patient with heat, lack of vital heat, with excessive weakness. I need one medicine with excessive weakness. Weakness which is specially marked after fever with swelling around the eyes and extremities, pressure amelioration, pain, pressure amelioration, extremities pain, lower limbs, fever during aggravation. So I made the repertorization with all these 11 symptoms. The symptoms showed me these medicines into repertorial chart: China, phosphorus, aconite, spongia, dulcamera, thuja, like that. So these are the selective symptoms which should contain my medicine. Then I considered the other group of symptoms also which I have left. You can just have a look on that. These are those symptoms which I have not taken into my main primary repertorization chart. And in this chart also, if you see China, arsenicum, lachesis, they are all coming up. If you combine the whole symptomatology, then China, ars, netamur, and phosphorus, these are the 4 medicines which are coming up. Now we have to choose one among them. So regarding this, I want your attention, because the eyes of the physician should be like this eagle when he is picking up his PQRS. So friends, in this case, I don't have much time because patient is already in a very critical condition. I cannot try any medicine. I cannot give any medicine like partially Millesimal medicine or anything, any ABCD medicine. So I thought to consult Materia Medica. So first of all, I read here the symptoms of the China. In this case, China covers maximum totality of symptoms, especially the eliminating symptom, that is profuse drenching perspiration at night during sleep. It is a very important symptom, and you can find it in C.M. Boger's book, A Synoptic Key to Materia Medica, page number 116. It covers the peculiar symptoms of the patient during fever. Fever gets aggravated after exertion. Thirst of the patient is very peculiar in this case, who is thirsty during sweating stage and during apyrexia. Again, you can find this symptom from Boger's synoptic key, CM Boger synoptic key on the same page number. He is thustless during heat stage of the fever. It covers the pain in the lower limbs during fever, which causes sleeplessness and gets better with pressure. China also covers the symptoms aversion to being disturbed. China also suits better to pale anemic patient with excessive weakness after fever. China also suits to chilly patient, especially who have tendency to take cold easily. It has a peculiar action on the bone marrow activity. If you open up Dr. S.R. Phatak's repertory or synthesis repertory or Robin Murphy's repertory, you will find that this medicine has a strong action on bone marrow, and I need that medicine only which should act on the bone marrow because all the things are happening there only. Now the second, because I cannot go with China blindly because the other medicines are also very tough competition with China. Like phosphorus, it covers maximum totality of the symptoms, like it gets fever after exertion with pain in the lower limbs due to which patient is unable to sleep, but the pain in the extremities does not get better with pressure, which China covers. Phosphorus also does not cover the weakness after fever. It also does not cover the peculiar thirst of the patient during sweat stage and during apyrexia. It also does not cover the nature of the patient, friends. That is aversion to being disturbed. Rather, on the contrary, phosphorus likes company and he feels even better in company. So this patient, he had a symptom that he doesn't want to be disturbed. So phosphorus should not be or could not be my medicine for this patient. The next very close competitor of China was Natramur, because it covers the grief of the patient strongly. The grief which patient was carrying all the time because he was all alone. Most of the expenses of his treatment, they were taken care of by his in-laws after the selling out of his own house. So he was missing his parents. He was missing his brother's association at this point of time. He was loaded with grief. So Natramur covers that, both gets fever aggravated after exertion. It also covers the peculiar thirst of the patient who is thirsty, but during sweat stage and thirstless during heat stage of fever. Both are restless during heat. It also has pain in the lower limbs during fever, which causes sleepless. Dr. Yashika, is it fine? Am I audible and visible to all of
Yes,
you,
sir.
please?
Absolutely. Absolutely. Everything is visible.
Okay, thank you very much. So this Natramur, it covers the grief of the patient. It covers fever after exertion, the thirst also. It also covers the pain in the lower limbs during fever, which causes sleeplessness. But Natramur does not cover the most important symptom of this case, that is profuse perspiration at night during sleep. This is the symptom of CML plus of the patient also. It's very important, very PQRS according to 153 aphorism of Organon. The pain in the extremities better by pressure is also not covered with Natramur. We also need a medicine which has strong effect on bone marrow, which is missing in this patient, in this Natramur. And you know all friends that Natramur is basically hot remedy and our patient is chilly. So all these medicines like Natramur, phosphorus, and these were all away from this case. Now going to arsenicum. Arsenicum gives a strong competition to China in this case. Both are getting fever after exertion. Both have pain in the limbs during fever, which is better by pressure. Both Ars and China are restless during fever and also sleepless because of pain. Both have excessive weakness also. Both are chilly and having tendency to take cold easily. But again, friends, I am missing this arsenicum, that it does not cover the most important symptom of the case, that is profuse perspiration at night during sleep. We also need a medicine which has strong effect on bone marrow, and arsenicum is missing here. So finally, the prescription was China, Syncona. The potency I chose 0/1, friends. Why? Because, see, in this case, if I prescribe the right medicine but in wrong potency, then also I can lose my case. So the selection of potency in such critical cases, terminal cases of cancer, is very important. We cannot give any potency because sometimes the lower potencies of other scale, like centesimal scale, they may be unable to touch the pathology of the case, and maybe unable to give any kind of positive results. And on the contrary, the higher potencies of the simillimum, they can aggravate the patient to the extent that they can kill the person, as Dr. Kent has given in first observation of Dr. Kent, killer's aggravation. So the first observation was regarding this. So I thought to go with LM scale, which is very, very safe, which is free from aggravations most of the times, and I can control anytime if anything wrong happens due to potency. So I chose China 0/1 TDS for this patient. Now the follow-up. Friends, I want to make a point, to share one point with all of you, is that when the patient was with me, he told me, doctor, I am already on my Gleevec, imatinib Gleevec for 400 mg. Shall I continue my allopathic treatment or not? I said, yes, you should continue your allopathic treatment. I am just giving you one medicine, which is a supplement or kind of additional support to your case. So this patient, he came to me after 15 days because he was sent with 15 days medicines. He said, doctor, I did not take allopathic medicine for 4 days. On 5th day, before starting that, I just thought to see the effect of your medicine, for which I got my platelet count checked. I was happy to see that count rose from 12,000 to 46,000 within 5 days of your treatment. TLC count rose from 2,500 to 3,500. See, friends, who says that homeopathy works slowly? You can see where nothing was working out. Even the SDPs were all not working in the hospital, in conventional hospitals. This China, the small pills or globules, that too diluted in the water, they are giving this wonderful result only on the 5th day of this medication. And on 10th day, this platelet count was 66,000. It was for the first time that he got up to this count. Appetite was increased for a few days, but again it decreased. Swelling of the face was decreased. Appetite disappeared completely, which were there in the mouth. Sleep is good, as there is no pain in the body, no fever in these days. He got dry cough. He said, I feel less weakness now and can walk for some distance without breathlessness. So he was kept on the same medicine. For again 15 days, I sent the same medicine. And on the very 3rd day after going back from me, he called me up from Oswald Cancer Hospital. He was very excited and his voice was very heavy. And he told me, doctor, my platelet count went up to 276,000 now. After 15 days of treatment, his platelet count became normal. The allopathic oncologist was very much surprised and got it rechecked in front of him. He said, no, your report is not right. I will recheck it. Come with me. I will go to the lab section. He went there and he asked the report to be done in front of him. Then the report was same and he was very much satisfied. After verification, he too was very happy and said that how it happened, as we tried our level best even with 5 SDPs last month in 10 days, that time it was not coming up. And this was very remarkable day for patient as well as for me, because on 28th January, that is after 28 days only, he reported me that there is no body pains now, sir. Appetite mouth is totally gone. There is no swelling at all. Appetite is totally normal. Sleep is totally normal. There is no fever in these days. He feels energetic. His platelet count went up to 377,000 and his HB rose up to 9 grams and his TLC is 6,400 now. The basophils are 0. Patient feels 85 to 90% better with this. You can see the before and after treatment report. Here you can see this is the report of 31st December 2012. If you can read it from here, this is from Oswald Cancer Hospital, and you can see this platelet count was 12,000 only, HB was 8.5, TLC was 2,600 only. But in this case, you can appreciate this, that this count rose up to 377,000 only after 28 days. See, this is what we can expect from right medicine in right potency, in the right repetition. Now, this is the detail of this report I have already shared with you. This is the patient. We can share this video with you.
हाँ भाई, तुसी मैंने अपना नाम दसो पहला। संदीप कुमार।
ਸੰਦੀਪ ਤੁਹਾਡੀ ਏਜ ਕਿੰਨੀ ਹੈ?
27 ਸਾਲ।
ਤੁਸੀਂ ਕਿੱਥੋਂ ਆਏ?
ਲੁਧਿਆਣੇ
ਤੋਂ ਆਏ। ਅੱਛਾ, ਤੁਸੀਂ ਤੁਹਾਡੀ ਤਕਲੀਫਾਂ ਕੀ ਸੀਗੀਆਂ ਜਦੋਂ ਤੁਸੀਂ ਮੇਰੇ ਕੋਲੇ ਆਏ ਹੋ? ਕਿ ਅੱਜ ਹੈਗੀ ਹੈ ਆਪਣੇ ਕੋਲੇ 31 ਜਨਵਰੀ।
ਹਾਂਜੀ।
ਤੁਸੀਂ ਮੇਰੇ ਕੋਲੇ 1 ਮਹੀਨਾ ਪਹਿਲਾਂ ਸਹੀ 1 ਜਨਵਰੀ ਨੂੰ ਆਏ ਸੀਗੇ। 1 ਜਨਵਰੀ ਤੋਂ ਪਹਿਲਾਂ ਤੁਹਾਡਾ ਕੀ ਹਾਲ ਸੀ ਤੇ ਤੁਸੀਂ ਹੁਣ ਕੀ ਮਹਿਸੂਸ ਕਰਦੇ ਦੱਸੋ ਮੈਨੂੰ?
ਉਦੋਂ ਤਾਂ ਮਤਲਬ ਸਰੀਰ ਦੇ ਵਿੱਚ ਬਿਲਕੁਲ ਐਨਰਜੀ ਹੈ ਹੀ ਨਹੀਂ ਸੀਗੀ, ਜਾਨ ਹੈ ਨਹੀਂ ਸੀ ਸਰੀਰ 'ਚ।
ਅੱਛਾ ਜੀ।
ਮਤਲਬ ਮੈਂ ਪੈਦਲ ਤੁਰ ਨਹੀਂ ਸਕਦਾ ਜ਼ਿਆਦਾ ਟਾਈਮ, ਮੈਂ ਮੂੰਹ ਤੱਕ ਨਹੀਂ ਜਾ ਸਕਦਾ ਜੀ।
ਅੱਛਾ ਜੀ।
ਨਾ ਮੈਂ ਖੜ ਸਕਦਾ ਜ਼ਿਆਦਾ ਟਾਈਮ।
ਓਕੇ।
ਮਤਲਬ ਉਸ ਤੋਂ ਬਾਅਦ ਫਿਰ ਜਦੋਂ 4 ਦਿਨ ਮੈਡੀਸਨ ਖਾਧੀ ਤੋਂ ਡਰੀ, ਫਿਰ ਮੈਨੂੰ ਥੋੜਾ ਜਿਹਾ ਮਹਿਸੂਸ ਹੋਣਾ ਸ਼ੁਰੂ ਹੋਇਆ। ਫਿਰ ਜਦੋਂ 15 ਦਿਨ ਖਾਧੀ, ਫਿਰ ਪਲੇਟਲੈਟ ਬਿਲਕੁਲ ਸਹੀ ਹੋ ਗਏ, ਨੋਰਮਲ ਹੋ ਗਏ ਸੀ।
ਵੈਰੀ ਗੁੱਡ।
ਤੇ ਹੁਣ 30 ਤਰੀਕ ਨੂੰ 28 ਤਰੀਕ ਨੂੰ ਟੈਸਟ ਹੋਇਆ ਤੇ ਮੋਹਦ ਦੇ, ਤੇ ਉਹਦੇ ਨਾਲ ਹੋਰ ਮੈਨੂੰ ਮਤਲਬ ਵਧੀਆ ਹੋ ਗਿਆ, ਸਰੀਰ ਬਿਲਕੁਲ ਠੀਕ ਹੋ ਗਿਆ।
ਜਦੋਂ ਤੁਸੀਂ ਮੇਰੇ ਕੋਲ ਆਏ ਸੀਗੇ ਉਸ ਟਾਈਮ ਤੁਹਾਡਾ ਪਲੇਟਲੈਟ ਕਾਊਂਟ जितने आए हो ਤੁਸੀਂ?
14,000 था। तब डॉक्टर कह रहे थे कि आप छुट्टी मत लो 1-2 दिन। तो हमने कहा था कि हम रेगुलर चेक करवा लेंगे, क्योंकि उन्होंने 14,000 पे वो लगा देते थे इनको एसडीपी, पर शाम को फिर 12,000 तक के आते थे एसडीपी लगाने के बाद भी।
प्लेटलेट्स लगाने के बाद भी वो 12,000 रहते थे।
आप इनकी रिपोर्ट में है?
दिखाइए।
होगा इनके रिपोर्ट में। एक दिन इन्हें लगे थे तो लगाने के बाद भी इनके वैसे ही थे। इनके 23rd जैसे आए थे ना, इनको लगे थे तब भी इनके 12,000 आए थे सर।
उसके बाद भी 12,000 आए?
12,000 ही आए इनके सर, लगने के बाद भी इतने ही आते थे इनके।
अच्छा, तो उसके बाद फिर आप मेरे पास जब आए यहाँ पे, मैंने आपको 1 जनवरी को ट्रीटमेंट देना शुरू किया। उसके बाद फिर आपके अंदर जो चेंजेस आई, आपने मुझे बताया कि
फिर 1 जनवरी से लेके 4 जनवरी तक हमने इनको कोई मेडिसिन नहीं दी, सिर्फ आपकी कंटिन्यू की। आपकी मेडिसिन कंटिन्यू करने के बाद हमने 5 को इनका ब्लड टेस्ट करवाया, क्योंकि उसके बाद हमने इनकी एलोपैथिक मेडिसिन जो डॉक्टर ने सजेस्ट की थी वो
करनी थी।
तो हमने कहा हमने सिर्फ इसी मेडिसिन का फर्क देखने के लिए हमने टेस्ट करवाया, ब्लड टेस्ट। तो इनके काउंट से
46,000। उसके अच्छा, पहले जब आप आए थे तो उस दिन 14,000 थे।
14,000 थे, तो इनके 46,000 थे
5 दिन के बाद।
हाँ जी।
उसके बाद फिर कब कराया?
फिर उसके बाद हमने 10 तारीख को कराया था। तो 65,000 थे।
वेरी गुड।
उसके बाद 17 को कराया था, 2,77,000 थे।
2,77,000। 2,77,000। और उसके बाद फिर
हमने अब कराया 28 को कराया, 29 को 3,77,000।
3,77,000। अच्छा संदीप, आप जब ये टेस्ट करवाते हैं तो आप उस बार से करवाते हैं ज्यादा है टेस्ट आपके जो वहाँ पे होते हैं?
सर रिपोर्ट नहीं ना मंदे, बाहर ਦੀ
ਰਿਪੋਰਟ ਨਹੀਂ ਮੰਨਦੇ। ਤੇ ਤੁਸੀਂ ਜਿਵੇਂ ਕੱਲ ਗੱਲ ਕਰ ਰਹੇ ਸੀ ਕਿ ਤੁਸੀਂ ਕਦੋਂ ਜਦੋਂ ਲਾਸਟ ਰਿਪੋਰਟ ਥੋੜੀ ਦੇਖੀ, ਤੁਹਾਨੂੰ ਕਿਸੇ ਡਾਕਟਰ ਨੇ ਕੁਝ ਕਿਹਾ, ਪੁੱਛਿਆ ਕਿਤੇ?
ਡਾਕਟਰ ਮਤਲਬ ਬਹੁਤ ਖੁਸ਼ ਹੋਇਆ, ਗੱਲ ਪਰਸੋਂ ਗਏ।
अच्छा,
परसों डॉक्टर बहुत खुश है, अभी बहुत जल्दी तो ठीक हो गया।
अच्छा,
कहते था उम्मीद नहीं थी, उनको उम्मीद नहीं थी, इनकी उम्मीद से बढ़ के वो फर्क पड़ गया,
उनको उम्मीद नहीं थी।
अच्छा, डॉक्टर जब हमने फर्स्ट टाइम चेक कराया था इनके थे
2,77,000।
हाँ, तभी डॉक्टर बोल रहे थे, कहते मैंने सोचा होगा 10-20 हजार ऊपर नीचे हुए होंगे।
अच्छा,
तो कहते काफी फर्क पड़ गया इनको।
अच्छा सारिका, आप क्योंकि अभी तो हम बात कर सकते हैं, क्योंकि इनके बारे में डॉक्टर का आप लोगों से क्या बात करते थे, क्या कहते थे इनकी सेहत को लेके, इनकी लाइफ को लेके, वो आपको क्या बोलते थे पहले?
डीएमसी में तो डॉक्टर ने हमें साफ कह दिया था, कहते नहीं आपके पास इतना टाइम नहीं है।
डीएमसी में शेखो साहब ने कहा था।
फिर इसीलिए मैं सलाह लेने के लिए गई थी डॉक्टर योगेश।
उन्होंने आपको क्या बोला था?
उन्होंने बोला कि हम टेस्ट करेंगे आपको।
नहीं, शेखो साहब ने क्या बोला था आपको?
हार्डली 1 मंथ और 2 मंथ।
ये कब की बात है?
नवंबर
के
21 और 22।
अच्छा, उसके बाद फिर आप उनको तो मिले ही नहीं? उनको तो
उसके बाद गए ही नहीं, जैसे हमारा मन टूट गया तो हम गए।
अच्छा, अब की हालत जो संदीप ਤੁਹਾਡੀ ਅੱਜ ਦੀ ਹਾਲਤ ਹੈ, ਸਿਹਤ ਹੈ ਜਿਹੜੀ ਤੁਹਾਡੀ, ਮੇਰਾ ਮਤਲਬ ਹੈ ਉਹਨੂੰ ਦੇਖ ਕੇ ਤੁਸੀਂ ਕੀ ਕਹਿਣਾ ਚਾਹੁੰਦੇ ਹੋ? ਕਿਵੇਂ ਲੱਗਦਾ, ਕਿਵੇਂ ਦਾ ਮਹਿਸੂਸ ਹੁੰਦਾ?
बिल्कुल ठीक, बिल्कुल ही ठीक,
थोड़ा मन चित खुश है?
हाँ जी,
बिल्कुल सेटिस्फाइड है।
डॉक्टर बोल रहे हैं कि जैसे हमने कल उनसे लेटर लिखवाई थी इनके लिए, तो उसमें लिखा हुआ था उन्होंने कि अब एक्सेलरेटर से क्रियोनिक में वापस जा रहे हैं।
Friends, can you listen this, that this doctor, he himself told to the patient that your case is reverting from accelerated phase to chronic phase. This is what we want from our medicines, that our case should follow Herring's law of cure. So this case was reverting back now from from the accelerated phase to chronic phase, it is coming back now. It's very important for us to understand.
हाँ भाई तुसी मैंने अपना नाम दसो पहला
सर
उसके बाद फिर आप उनको तो मिले ही नहीं, उनको तो
बिल्कुल ही ठीक, मतलब
थोड़ा मन चित खुश है हम।
हाँ जी, हाँ
बिल्कुल
बिल्कुल
सेटिस्फाइड है।
डॉक्टर बोल रहे हैं कि जैसे हमने कल उनसे लेटर लिखवाई थी इनके लिए, एक तो उसमें लिखा हुआ था उन्होंने कि अब एक्सेलरेटर से क्रियोनिक में वापस जा रहे हैं, शिफ्ट बैक टू एक्सेलरेटर, बैक टू क्रियोनिक।
हम लोग मतलब जो है वो इम्प्रूवमेंट की तरफ चल दिए हैं और इंशाल्लाह बहुत जल्दी हो भी जाएगा। आप खुश हो पूरी तरह से?
वो सेटिस्फाइड हो, हम बहुत खुश हैं। हम तो कल ही बहुत खुश थे परसों जब हमें डॉक्टर ने बताया कि अब तो बिल्कुल ठीक है, अब कोई मतलब टेंशन वाली बात नहीं है। पहले तो हमने 2 महीने एकदम पता ही नहीं होता था अब क्या करें, सब मतलब परेशान ही रहते थे। अब सब खुश हैं।
अब सब खुश हैं। ओके, थैंक यू वेरी मच।
So friends, this case was reverting from accelerated phase to chronic phase, and this is the comparative reports after 28 days. You can see on 1st of January, the first line you have seen already the reports, and you can compare after 28 days the comparative study of conventional medicine as well as of homeopathic medicines. You can see the obvious change. So this is what homeopathy offers to us, to such patients. Dr. Yashika, shall we go to the next case now, please?
Yes, sir. Yes, sir.
Okay, thank you very much. Okay, thank you. Friends, now we will go to another case, which is long case, but I will go a little more quickly. Am I going fast or am I slow, Dr. Yashika?
Sir, fine. It's perfectly fine.
If I take 5-10 minutes more, would it be fine? Because already it is 4:40.
You can take any more time, sir. It's okay. People are enjoying.
Okay, thank you
Yes,
so
sir.
much. That's fine. That's fine. Because already they are sitting since long time. That's what I'm asking this big, because I want to make you understand, everybody, that how I have entered into the case, not only to show the reports and all. Now, coming up to this case, this is a case of periampullary cancer. These slides are visible to you all?
Hanji, sir.
Right. Periampullary cancer is a cancer that forms near the ampulla of Vater, an enlargement of the ducts from the liver and pancreas, where they join and enter the small intestine. It is somewhere here. Now, pancreas cancer is one of the least frequently occurring cancer, but it is one of the most notorious and deadly. It is the 7th most common cause of cancer deaths. The predominant site of pancreas cancer origination is the head of the pancreas. Patient with a pancreas head tumor may be diagnosed in an earlier stage than patients whose pancreas cancer starts elsewhere, as the pancreas head tumor may compress the common bile duct, causing biliary obstruction and resulting in jaundice. The classic triad of findings for pancreas cancer consists jaundice, weight loss, and abdominal pain. So this case was stage 1B. Stage 1B means the tumor is limited to the pancreas and is of 2 centimeter or more than 2 centimeter in greatest dimensions. Patients diagnosed with localized pancreas cancer, that is stage 1 and 2, have a 29.3% 5-year survival rate. So in this case, which I am sharing with you all, friends, in this case, this patient has 5-year survival rate only 29%, or in other words, 71% of the patient, they die before completion of 5-year survival. The median survival for the patient with resected pancreas who receive adequate therapy is 20 to 23.6 months. Those patients who had underwent this Whipple surgery or pancreaticoduodenectomy, those patients after resection, they have the survival period only 20 to 23.6 months. That means almost not even 2 years completely. A Whipple procedure, also known as pancreaticoduodenectomy, is a complex operation to remove the head of the pancreas, the first part of the small intestine, duodenum, the gallbladder, and the bile duct. It is the most often used surgery to treat pancreatic cancer that's confined to the head of the pancreas, After performing the Whipple procedure, your surgeon reconnects the remaining organs to allow you to digest food normally after surgery. You can see here the Whipple procedure. This is all the normal organs lying at their own place, but in this case they cut down all the things and they make direct connection of the stomach to the intestines, because the duodenum part has been cut out here. Now this is the case. It's a Riazuddin patient who is coming from Jharkhand. He's 26 years, divorcee, laborer class person from Muslim family, and the case was taken on 16th of August 2010. That is almost more than 10 years back. Now the persisting complaints. Presenting complaints. He had severe weakness after surgery and used to walk with the help of stick. He had fever and pain in the operated area most of the time. These are the two symptoms only with which patient came to me directly after operation. This is the patient. I don't want to waste much time with this video. I will show the next videos with you. Now, history of presenting complaints. In February 2010, he got sudden and violent pain in the left abdomen, for which he took some allopathic treatment. But after a few days of this, he developed jaundice and lack of appetite. It was because of the compression of the common bile duct, because of this tumor which was covering the ampulla of Vater, and it was compressing the bile duct. So because of that compression, this patient developed jaundice. Someone suggested him to take some herbal treatment for this jaundice, but it further aggravated his condition as his serum bilirubin level kept on increasing. His ultrasonography dated on 19th of April 2010 revealed he usually distended gallbladder with dilated CBD and MPD. There was an associated hepatomegaly. His upper GI endoscopy revealed large polypoidal lesion with ulcerated surface in the ampullary region, biopsy of which later revealed atypical glands suspicious of malignancy. Subsequent CT scan revealed ill-defined space-occupying lesions at ampulla, causing biliary and pancreatic duct obstruction with retroperitoneal lymphadenopathy. Finally, he got admitted in Rabindranath Tagore International Institute, Kolkata, on 3rd of May 2010 with his serum bilirubin 7.23 milligram per deciliter. Here, his pancreaticoduodenectomy was done on May 11, 2010. The histopathological report after this was tumor size was 2 into 2 centimeter, and extent of the tumor was infiltrating the muscle layer of duodenum and subserosa, and the diagnosis made was periampullary adenocarcinoma. You can see here from Rabindranath Tagore Institute, Calcutta, he did all this, and here you can see the diagnosis, periampullary adenocarcinoma stage 1B. This is the discharge summary from the same hospital. After the operation, he was told to take radiotherapy followed by chemotherapy, but it was very much expensive for the patient, so he preferred to seek some other alternative. And finally, one of his cousin brother, who is a homeopath in Bihar, he referred this case to me. Past history: patient had recurrent cough since his childhood. Once it comes, it goes with very much difficulty. He also had eruptions on the skin in childhood, treated by external applications. So you can see very, very well, friends, that he had history of eruptions on the skin which were suppressed with external applications. And you can see in the family history, one brother died with kidney failure and father died of tuberculosis. Now, what was the purpose of his visit? Because he has already underwent surgery. His purpose was, number one, he was in need to get any substitute of allopathic treatment in this post-operative cancer case. Number two, he does not want his cancer back. These were the two objectives with which he came to me. Now again, we have to define the problem. This post-operative case of periampullary adenocarcinoma of pancreas had come after operation, and allopathic treatment so had paucity of symptoms. Whenever patient comes after any conventional treatment regularly, then most of the symptoms of the patient would be masked or suppressed or subsided. So the case would be having the lack of symptoms or with paucity of symptoms. So we need to prescribe a general constitutional medicine to strengthen the constitution of the patient, which in turn can take care of remnants of disease and also can prevent the recurrence of cancer. So friends, in cancer cases, the approach for different types of patients is totally different. It's not something which is stereotypic. It's not one type of approach we have to deal with the cancer patients. In the first case, you have seen the different approach, and in this case, I am looking for the constitutional medicine of this case. Now, patient as a person, his appetite was normal, his thirst was normal, average. He desires fish, rice, cold milk, even in winter. Aversion is nothing specific. He feels heaviness in the abdomen after eating since after operation. Stools are normal. Urine, he cannot control the urge of urination and has to rush for it. Sleep is normal, prefers to lie on his back. Dreams, nothing significant. He is a heart patient and perspiration is normal. Now, the state of the patient was okay. He was only 49 kg weight with 5.5 feet height. You can see the nutritional status of this patient was poor, and he had post-surgical generalized edema with his patient. You can see there is pale tongue, pale skin, which is the common thing for this patient, and he had hair falling, nail was pale. Mental symptoms. Basically, he does not like uncleanliness. Though he is doing this labor, Raj Mistri, those who are working with this all building materials and all, he gets angry if someone makes the things dirty. He wants to earn money very fast to support the family because his father is no more. So he works very hard. He takes responsibility seriously. If he commits any promise, he keeps his words. He cannot support any injustice. If someone bothers poor people unnecessarily, he stands beside poor people. He is a courageous person, faced all the hospital procedures boldly. Now, the life space of this patient, he is the eldest son of his parents. He has two brothers. One died of kidney failure. Father died of tuberculosis when patient was only of 6 years. He has the whole responsibility of the family. He got married 5 years back, that is in 2005. According to the patient, the nature of his wife was not good, as she was not an obedient wife. Moreover, she was not beautiful also. Now, most of the time, this patient used to stay in Ghaziabad as he did not like her. If he is in station, he used to beat her about once a week because of her disobedient nature. He used to feel that he got married with a mad lady. This marriage lasted only for 3 years and finally he divorced her thereafter. Now he feels very happy and relaxed. Now, in this case, we need to assess the diathesis and the miasm. Now, regarding the diathesis, patient has tubercular diathesis due to his family history of tuberculosis and his own personal history of getting recurrent cough. Then the miasm was multimiasmatic case. According to Dr. Honeyman, this tubercular is a diathesis, not the miasm. So now, classification and evaluation of the symptoms. So we have classified and evaluated the symptoms here. Qualified mentals, physical, generals, and particulars. You can see in the mind section, there is a rage, +2, injustice cannot support, +2 marks, responsibility taking seriously, and fastidious. He is courageous also. He is optimistic. Now, as far as physical generals are concerned, he is a heart patient, 2+, tendency to take cold easily, 2+, desire cold milk, 2+, desires fish, 2+, desires rice, again sleeps on back. And I need a medicine which is having a effect on pancreas, because we have to treat this case. I need this rubric also. Abdomen pancreas complaints of cannot control the urge of urination. This case, regarding the selection of the repertory, because this case has constitutional, mental, and physical generals with few particulars, so synthesis repertory, which is the expanded version of Kent's repertory, would be the best selection. So this is the selection of the rubric in this case. Courageous, fastidious, injustice cannot support, optimistic, rage, responsibility taking too seriously, abdomen, pancreas, complaints of bladder, urination, urging to urinate, sudden hasten to urinate or urine will escape, sleeps on back, tendency to take cold, desire for fish, cold milk, rice, and hot patient. So I need all these symptoms into my medicine. So after this repertorial chart, I got these few medicines: phosphorus, pulsatilla, sulfur, nux vomica, calcarea carb, like that. Now the differential diagnosis of the remedies. Number one, because this causticum, though it is not visible in this chart, maybe it is little far from this, but because of his injustice cannot support, and he is very benevolent, courageous person, optimistic. I thought that it can be causticum. But when I made the differential diagnosis from Materia Medica, which is the last court of appeal, regarding this causticum, though this medicine does not tolerate injustice, but it does not have any affinity to pancreas. So this is very important for me. I need some medicine which should have affinity to pancreas as well. It also does not have any desire for cold milk and rice, which is very marked with +2 grade with this patient. So it also does not take responsibility too seriously. Now, because of his nature of courageous, injustice cannot support, fastidiousness also, easily getting angry, this Naxumka, it was also coming into my mind because it was very close in repertorial chart as well. Though Naxumika covered fastidious, rage, courageous, injustice cannot support, and optimistic symptoms, it take cold easily, cannot control urination, and has action on pancreas, but it does not cover a desire for cold milk. You know, Naxumika is already very, very chilly and desires hot beverages. So, but this patient of mine, he desires cold milk, fish, and rice. In this patient, desire for cold milk is very important. He likes it even in winter. So, pulsatilla, though pulse was very next to phosphorus in repertorization, but it failed in the last court of appeal, that is Materia Medica, as patient is not yielding, not mild, and does not have that kind of weeping tendency. It also missed in desire for cold milk, fish, and rice, so it was left. So next medicine was sulfur. Though sulfur is hot, courageous also, cannot tolerate injustice, it is optimistic also and has rage also, but it does not cover the seat of disease, which is very important for me. So finally, I thought of phosphorus. This medicine was selected because it covers seat of the disease, that is pancreas. Friends, whenever I take cancer case, I give lot of time to repertorization, lot of time to consult Materia Medica. You can see this is all work which I do when I take my cancer cases in my clinic. So to confirm, because I have to give one shot of the right medicine and I have to wait and watch, that's all. So my medicine should be the right one. So in this case, when I thought about phosphorus, if you open the repertory, clinical repertory of clerk, you would find there is a clinical repertory, pancreas disorders of only one medicine, phosphorus is there. And my medicine is covering maximum totality also. In clinical repertory of clerk, phosphorus is the only medicine which is covering disorders of the pancreas. If you see boric, then you can find there are 18 medicines along with phosphorus which are for pancreas affections of. If you see BBCR, Boger-Bonigashen's clinical characteristic repertory, you would find 15 medicines, and you find pancreas is covered with this phosphorus with 2 marks. If you find Fatak, then you can see it is there among 7 medicines. In phosphorus is also carrying 2 marks. In Murphy also it is there among 13 medicines. In Kent, if you see abdomen pancreas, there are 5 medicines, among which is phosphorus 1. And Dr. Farrington says, when I love Farrington to read many times in all that differentiation also, phosphorus is one of the few remedies that act on pancreas. It is in Clinical Materia Medica of Farrington. And when I took up this Tyler's book, Tyler says in his pointers to common remedies, some remedies of the pancreas under phosphorus, she writes, phosphorus is one of the few remedies known to act on pancreas. So I was confident that my medicine, the seat of action is very well covered with various authors, all authorities in homeopathy. Now, when I took all these rubrics of different repertories, phosphorus was coming up, but then I thought regarding the constitution, regarding the mind of the phosphorus, because we know phosphorus is very, very affectionate, very smiling faces and all, benevolent, sympathetic, and very cool-minded. I was not satisfied regarding the mental symptoms of the patient, that my phosphorus may be not covering that. But when I consulted chronic disease, where Dr. Honeyman has described phosphorus, I will go up to that. But regarding the constitution, because in chronic cases, Dr. Honeyman says in the aphorism number 5 that the physical ascertainable constitution, ascertainable physical constitution, we should must take into consideration when we are taking chronic cases. In this case, patient was lean, thin, with a dark complexion. According to Dr. Kent and Dr. Fatak, this constitution is covered with phosphorus. In chronic diseases, Dr. Honeyman says about phosphorus, it is very easily irritated to vexation. He is vexed at every trifle, so that he is besides himself. She would get vexed very readily. When annoyed, she falls into furious anger and malignancy. Friends, see, Dr. Herring says in his guiding symptoms of our Materia Medica, in the section of mind, that patient is excitable, easily angered, vehement, from which he afterwards suffers. So I was satisfied. I took long breath that my phosphorus is also covering the mental side or the emotional side of the patient. And there was recurrent cough since childhood. Once it comes, it goes with very much difficulty. It's an important symptom of phosphorus. Father died of tuberculosis, tubercular diathesis, history of tuberculosis, all they were indicating to phosphorus. So my medicine is nothing but phosphorus, phosphorus, and only phosphorus. So phosphorus was given again here in LM potencies. It was started on 16th of August 2010. Now the follow-up. Friends, on the very next day, next week, I got a phone call from the patient. He told that he has pain in his left abdomen, which increases and decreases slowly. It was very violent pain, which made him restless. So he needs medicine for this. Friends, before his operation, he had the same pain there in the same area. Even after he went operated, again he got the same pain, which was very violent one, which made him very much restless, and it was increasing and decreasing slowly. These were the symptoms: restlessness with pain, abdominal pain increasing and decreasing very gradually, pain was very violent. So it indicates that patient may be needing some medicine like platina or some stannum metallicum. But I was very, I was thinking that my medicine should be very aggressive in this case. As the pain is there, very much violent, my medicine should be having violent action. So platina and stannum met, they are not that aggressive kind of medicines. I need medicine like chamomilla, belladonna, and aconite kind of patient, or nux vomica even also. But the pain was increasing and decreasing very gradually. So it is something which were hindering my prescription. But when I opened the repertory, I was surprised to read that in belladonna also, pain is increasing gradually and decreasing gradually. And this entry was done from Dr. Honeyman's Materia Medica Pure. It is so authentic medicine for even those complaints, in those complaints where the complaints are coming gradually and they are going gradually. Friends, I always request you to please refer the source books every time you are dealing any case, particularly like any challenging case if you are dealing like this cancer. Because this patient, he came to me directly after getting his operation done. He came to me, doctor, do you have any medicine for my purpose? Because otherwise I need to go for chemotherapy and radiotherapy. So I need to give some medicine which should be substitute, rather better substitute for my patient. So if my medicine is right, then the things are possible. But if I am here and there nearby, not the minimum medicine I am not giving, then I can lose my objective and my patient also. So I prescribed him belladonna 0/1. Normally we do not think belladonna in these cases where pain comes gradually and goes gradually. But in this case, I prescribed 0/1. It is follow well also. We need to see the relationship also with the given medicine. So I told him to take it every 15 minutes until this pain decreases. And this is the further follow-ups, friends. After 1 month, he told me that he is feeling better, and he was given phosphorus 0/2. There is no weakness in the next month. There is no weakness now. No tightness in the abdomen. Heaviness in the abdomen was decreased. There is no frightful dreams. Patient feels 80% better overall. I put him on 0/3. And in the next month, he got little cough, which brought some abdominal pain. Rest of the complaints decreased further. I put him on 0/4. So similarly, the time was passing on, and in the next year, I mean after 4 or 5 months, he said that I feel 100% better this time. He told that he has resumed his job after 4 or 5 months, because he came to me in the month of August, and after 6 months he said that I have resumed my job, which is very hard work also. It's not sitting job. It's not sedentary job. He had to do little hard work. And he said, I have resumed my job without feeling weakness. He was very happy and satisfied. He was put on 0/6. Until today, he is under my guidance, supervision and treatment. He is on next potencies. This is the follow-up, friends, after 4 years. Would you appreciate that this patient, according to the literature of conventional medicines book, they say that those patients who come to you after Whipple surgery, they are having medium survival period of not more than 2 years. But my patient is sitting in front of me after 4 years. So this is what homeopathy has offered him. So I will see. This is the case. He is alive, still alive.
क्या हाल चाल आपका? पहले ये बताइए, जिस चीज के लिए आप आ रहे हैं मेरे पास 4 साल से, क्या हाल है उसका?
हम तो ठीक है, दिक्कत नहीं है।
हाँ?
दिक्कत तो नहीं है, लेकिन एक ऑपरेशन क्या था, फिर थोड़ा सा सिलाई में ऊंचा शुरू से ही था, और कभी अगर पेट भारीपन हो गया, गैस बन गया, या खाना खुल के नहीं हुआ, तो उस जगह थोड़ा सा कील सा चुभता है।
कतार की तरफ बाहर निकालो तो
ये छूने से पता चलता, देखने से पता नहीं चलता।
अच्छा, आपको महसूस होता है सर?
जब
I just want to tell you this cut. This cut was so big in the abdomen. The whole abdomen was there, cut like a dome. So he came to me after 4 years and had very mild problems. He made his last visit on May 2018, friends, after 8 years, and he was fit and fine. He had no problem. His physical journals are still fine without bothering him. He was very happy and satisfied with the treatment. This is the video after 8 years, friends. This patient after 8 years. It is in my new center. Yashika, is it audible? Dr. Yashika ji?
Yes, sir, it's audible. Just keep your laptop volume full.
I have made my volume full. I don't know, something maybe.
लगभग 5-6 साल से ज्यादा
कैसा रहा?
एकदम अपने मन में कोई तकलीफ ही नहीं रहा कि हम बीमार हैं, या कोई बीच में मजबूरी भी नहीं आया मेरे पास।
कोई तकलीफ भी नहीं, कुछ भी नहीं।
He says, I don't find any problem in between also. He is perfectly fine after 8 years.
सब कुछ ठीक है। काम वाम कर रही है आप, अच्छे से कर रही है। उस काम करने के टाइम पे जो एक जैसे मरीज को तकलीफ होती है या कमजोरी महसूस होती है, वैसा बीमारों जैसा कभी कुछ महसूस हुआ नहीं। आप खड़े होकर जरा बताएंगे कहाँ पे आपका ऑपरेशन का जो पॉइंट था वो?
This was the cut for Whipple surgery.
ये पूरा काट के किया गया था, ठीक है। ये कलकत्ता से हुआ था बेटर। हाँ, तो ये तो हो गया आपका जो आपको कैंसर बताया गया था। ये तो आपका चल रहा है सर, आप दवा लगातार खा रहे हैं आराम से। अभी आप कितनी देर के बाद मेरे पास आए हैं, अंदाजा है कुछ?
He made his visit after 2 or 3 years because he is normally asking his medicine to get courier.
तो 4 दिन के लिए निकल गए तो घर में रह गए तो ऐसे हो जाता है। बाकी घर में होते हैं तो याद करके खा लेता हूँ।
अच्छा, वो जो ट्रीटमेंट आपका चल रहा है, उससे आप सेटिस्फाइड हैं?
एकदम सेटिस्फाइड, उसमें कोई दिक्कत नहीं।
See, this is the pleasure of prescribing. If patient is satisfied after 8 years of his cancer treatment with full energy, normal life, then what else homeopathy should offer to the patient? This is what evidence-based patient says. Reports are okay. Patient is talking from his own mouth.
जैसे आपको खुशी भी है इस बात की, आपका शुक्र है कि कुछ ऐसी प्रॉब्लम दोबारा नहीं है, तो इस बात को लेके आपके मन में होम्योपैथिक सिस्टम जो दवाइयाँ हैं इसके बारे में कभी कुछ आता है, बाकी दवाइयों को सोच के लिए कि ऐसा कि ये दवाइयों का आपके मन में कैसा क्या सोच है?
ये सोच तो ये ऐसा कि जैसे एलोपैथिक है वो तो फौरन ही काम करता है और वो जड़ से नहीं मिटाता है। सबसे पहले मन में तो इससे पहले जब हम इलाज करा रहे थे, जब आपके पास आए, मेरा चाचा का लड़का होम्योपैथिक का प्रैक्टिशनर है।
अच्छा, कहाँ पे है?
वो झारखंड में है। आप तो भागलपुर गए थे सेमिनार में, वहाँ से आपका मुलाकात हुआ, तो उसी ने बताया कि दिल्ली का डॉक्टर है, वहाँ पे दिखाओ। हाँ, दिल्ली के नाम से जान रहा था।
अच्छा,
तो फिर हम दिल्ली आए, आपसे कॉल किए, नंबर किसी तरह मिल गया मुझे, कॉल किए तो यहाँ पे आप जगह का नाम बताए, तो यहाँ मुझे पता लगा, तो यहाँ मेरा मामा का लड़का काम करता है, तो फिर हम उसके पास आके लोकेशन मेरा नजदीक हो गया, तो फिर वहाँ से जैसे वो लोग ठेका लेते हैं हॉस्पिटल वाले, तो उसने लगा दिया जनरल, तो हमारे ऊपर 4.5 लाख का बिल कर दिया उसने।
ओह, अच्छा।
अब तो वहाँ से मुझे 10,85,000 उसको दिए कि
So friends, this is the last follow-up which I got this video on 5th of this month, 5th of September, after 10 years. I requested this patient that kindly send me your today's video because I had to present your case in one of webinar on Teachers Day. So this is the last video of and last slide maybe of this case. It is only for 1 minute. Just listen this please after 10 years. The voice is little poor.
ऑपरेशन हुआ था, उसमें मीडिया होता है, जॉन्डिस बोलते हैं उसे, हुआ था। वहाँ से फिर हम प्राइवेट डॉक्टर को धीरे धीरे दिखा रहे थे, दिखाने के बाद फिर उसने मुझे कलकत्ता ट्रांसफर कर दिया। कलकत्ता में जाके हम रविंद्रनाथ टागर हॉस्पिटल में यानी कि ऑपरेशन कराए। ऑपरेशन कराने के बाद जब दवाई हुआ लेके घर आए, घर आने के बाद फिर बुलाया उसने 45 दिन के बाद, फिर मैं गया वहाँ, तो उसने मुझे 1.5 लाख का खर्च बता दिया, 25 महीने पर मंथ का। तो मेरे पास पैसे नहीं था, तो फिर हम घर लौट के ऐसे खाली पीली चले आए। यहाँ पे बैठ के 2-4 आदमी ने सलाह किया कि डॉक्टर होम्योपैथिक का डॉक्टर बढ़िया है, उसे एक बार दिखाओ। हम यहाँ से घर आने के बाद पता चला कि दिल्ली में है डॉक्टर। दिल्ली आए, दिल्ली से फ़ोन किया हमने, तो डॉक्टर साहब ने बोला मैं पंजाब में हूँ, यहीं आ जाऊँ। मैं पंजाब पहुंच गया। तो फिर 2010 से ही दवाई डॉक्टर का चल रहा है, और आज मेरा सेहत बिल्कुल ठीक है, ना कोई अंदर से प्रश्न है, भूख या सारे कुछ ठीक है, उसमें कोई दिक्कत नहीं है। और आज तक का मतलब ये है कि 5 सितंबर 2020 तक मैं बिल्कुल ठीक हूँ, कोई परेशानी नहीं है।
So this was the last video which I requested this patient to kindly send to me so that I could present his last update. So what about his purpose of visit? I think it is fulfilled as he did not get his cancer back today, and he also did not need any kind of chemotherapy or radiotherapy or any other kind of medicine. So this is what homeopathy offers to such patients. So Jai Hanuman, Jai Homeopathy. And I thank Dr. Yashika Roda and all the BJN team of 360 for inviting me in this wonderful event to share my little knowledge of treating cancer with homeopathy. And I also thank one and all the great audience who has beared with me with this time, who has listened me. Thank you once, all of my friends. And before ending to my speech, I would request all of you to have a deep knowledge of Organon of medicine, Repertory as well, and try to give importance or try to give some time to LM potencies. In most of the cases, nowadays, especially when there are so many antidotal effects of different things we are living in, so LM potencies are the need of the time now. Not only that, but Dr. Samuel Hahnemann, he spent almost all of his life to minimize the undue aggravations of his patient's complaints. He had started with his large doses of crude substances. Then he slowly refined his medicines, and he's invented this one potencies. Then he came up to 50 millesimal potency. Lately, with his mature mind, when he was in his Paris practice. So LM potencies are very effective in such type of cases, because we don't have any fear of fear of aggravations, and these potencies are very effective also. So thank you once again. Thank you very much, everybody. Thank you, Dr. Yashika, again for hosting all this very nicely. Thank you, one and all. Thank you, please.
Thank you so much, sir. You can come back to the Chrome.
I'm coming back.
Thank you so much, sir, for a wonderful session. It was so knowledgeable, so knowledgeable. We were getting so many comments that people enjoyed it so much. It was really appreciable and very well explained, all the cases. Plus, the videos were so that gave a lot of confidence to the audience. I hope they enjoyed. So we have some questions. Can we discuss them?
Yes, why not? I always enjoy this.
First question is, where can we buy the book 50 millesimal of yours?
Only with Beach, and I am writing nowadays the second edition, Yashika. The other day I was talking with Manish Jainji that maybe in the end of this October I will give you this manuscript, because first book I have totally exhausted. More than 1,000 copies has been given and sold out worldwide. So the next book is coming with Bijan only shortly. Maybe by the end of this year you will get all that in detail.
Thank you, sir. Okay, so you can contact Bijan, or you can see the website of bijanbooks.com for ordering. Sir, there is a question. You started medicine phosphorus 0/1.
Yes.
But after 4 years, what was the potency?
Yes, this is very wonderful. Dr. Yashika, would you believe me that this patient was kept only on phosphorus till today? No other medicine.
Great.
No other medicine, absolutely. It's something very, for the first time in my practice, that for long 10 years you are not changing your medicine. Of course, the potency I was changing every time little more, this one, and the repetition of the medicine was at longer intervals when the patient was fine. Hello?
Thank you, sir. One more question. Dr. Durgesh is saying he has read some book on cancer treatment and medicine they prescribe. So nosodes of cancer plus totality based medicine. So he wants to know, what is your view, like nosodes plus medicine based on the totality would give good results in less time, or what is your experience?
Yes. It is very important and very good also to prescribe nosodes at appropriate time, but every nosode should have some indications also. It's not that every time we should give blindly. Many practitioners, they keep on giving like carcinosinum maybe after a few days. If patient has some indications, I remember most of my cases, many of my patients, they are getting medrinum, sometimes this one carcinosinum, or sometimes tuberculinum, depending upon the family history or past history of the patients, as well as the present totality also. Yes, he is very right. If we prescribe nosodes along with our totality of medicines, then the results will be cut short.
Thank you, sir. One more question. What to prescribe for metastasis cases?
See, Dr. Honeyman has very nicely described in third aphorism, in what is to be cured in a case. We need to know. We need to define the problem. We need to see what is to be cured in the case. If I find, sometimes I will come up with this, fourth stage of cancer cases. I have some of the cases which are totally fine till today. There are few patients which are totally fine till today. That was the case of fourth stage of cancer of tongue. I will show you the videos, the reports, everything. And in terminal cases, maybe the primary stage of this one, first stage, second stage, every time we should look for the indications only. There is not a hard and fast rule that we should give this kind of treatment. It is not, in homeopathy, what is first aphorism? We have to treat the sick, not sickness. We have to see what are the PQRS, 153 aphorism. What is most important, what is to be cured in the case, we have to decide according to the case totality. We have to pick up from them. So I always follow Organon. I always follow the protocol which is given laid down by Dr. Simon Hahnemann.
Thank you, sir. Dr. Twara wants to know, in the first case of CML, once the patient reached the chronic state, what was the further management?
See, he was kept on the various indicated, because in most of the cancer cases, because it's a chronic case and we have to prescribe the zigzag way of prescription. It's not one prescription which we can keep on giving with the patient. So this patient, he had repeated exposure to cold air. Sometimes he was put on arsenicum, sometimes he required phosphorus also, and sometimes he was given natramune also. It was all on the totality of the symptoms. Whatever totality was coming up, I was taking care of that according to the situation and point of the time. So it was very wonderful, because this thing only we are expecting from our case. If our case is reverting from accelerated phase to chronic case, this is what we can do. And the time when I handled that case, when this case came to me, that the life of the patient was almost over according to the conventional statements. Yashika, hello. Hello.
Yes, sir. Yes, sir. Yes, sir.
I remember when I presented this case in Liga in Paris in 2014 or 16 maybe. So I got highly, high appreciation from the audience. One doctor, he was from Stuttgart, from Germany. He came to me from the audience and he took the mic from my hands and said, this case of Dr. Hussain is the answer to those people who do not believe in homeopathy. In Liga, though many people, they are converted homeopaths, they are coming into them. So this was it was one of the wonderful case of my life when I got result like, something out of nothing. It was that kind of situation with me. And I really thank Syncona, China officials who gave me this support.
Great, sir. So we have another question. Each for 0 by 1 of the potency, for how many days each one was given?
For example, normally what I do is, if I see, it all depends upon the frequency of repetition. If it is belladonna, you might have seen in the second case when patient reported me acute pains. So in that case, I started repeating every 15 minutes. In chronic cases, normally in cancer cases, I repeat it TDS 3 times a day. Most of the cases, I repeat 3 times a day.
Thank you, sir. One more question. How to decide when to stop the medicine?
In cancer cases, normally it is not easy to decide, because if patient is fine, then you should not stop. This is my personal opinion, because most of the times patient's life is not that long already. So when patient comes to me and he says, doctor, if it is possible for me to, even this case, Riazuddin, I have showed you many times, I have requested him, Riazuddin, you are fine, you stop my medicine, why are you wasting your money? He said, doctor, I am paying you money, no. What's the problem to send me the medicine? So in my experience, I have never stopped the medicine, except few of the cases which were very, in the very beginning stages, maybe stage 1 or 2. In those cases, when the patient is fine, when the patient is out of his acute problems, then I give his constitutional treatment, then I wind up the case. In few cases, not most of the cases. Normally the rule in other types of cases, when the patient is totally cured according to 161 aphorism of 6th edition, when patient is showing back his original symptoms in a milder way, those symptoms with which patient has reported you on the first day, if after your medicine those symptoms have disappeared completely, and at the end of your treatment, when the patient is at the verge of cure, at the border of cure, that time, if few of the old symptoms, few of the original symptoms, if they are starting coming back according to 161 aphorism, then we should stop the medicine, or we should increase the interval of repetition, because that is the homeopathic aggravation which we get at the end of the treatment if we are using LM potencies. In centesimal potencies, we are getting it in the beginning only.
Thank you, sir. There is a question on YouTube. What was the time interval to repeat the dose in LM potency? And in the phosphorus case, when you repeated the medicine?
In the beginning, it was kept TDS every day, 3 times a day, in the morning, afternoon, and in the evening. When patients started telling me that, doctor, I am fine, then it was made BD, then OD, then gaps of the days also. This is what Dr. Honeyman has done. If you get any opportunity to study Dr. Honeyman's Paris case books, which I have an access to, I am lucky to see those cases. In those cases, Dr. Honeyman used to ask his patients, you take my medicine, you see the effect of my medicine for this dose. If his dose of any given medicine, suppose it works for 5 days, Dr. Honeyman used to prescribe the medicine on 4th day of his, he used to make 4 days gap in between the interval. So like that. We have to assess it, and every case it is different. In every case it is different.
Thank you, sir. One more question on YouTube. In gross pathological advanced cases of cancer, whether we should concentrate on constitutional remedy, that is including mental and physical generals, or on pathological condition, we can give a specific remedy.
See, I ask you, Yashika, in those advanced cancer cases, in advanced pathologies, where is the constitution? It is totally broken up. The constitution is not that strong that you should prescribe the constitutional medicine. This is the place where many of our colleagues, they make mistake. This is the problem. Because of this only, Dr. Kent has written first observation. He says in that first observation, in deep pathological cases, do not prescribe the similar medicine in higher potencies. But of course, if it is the only medicine which is indicating, you can go for that also, no problem. But try to give the medicine which is for the problem at that point of time. As I have given that China in first case, that was not his constitutional medicine. But in the second case, when his constitution was better one, I prescribed this phosphorus in the second case. So every time if you keep on asking his constitutional symptoms when the constitution is already broken up or already very, very weak, in that case, vital force is not strong enough to give you the response quickly. Otherwise, you can create one strong turmoil in the vital force which can aggravate the problem. But in certain cases, when the chronic medicine or the deep antisoric medicine is indicated in that terminal stage also, in that case also, you should be a little more cautious. You can prescribe that. There is no hard and fast rule for that.
Sir, another question from Dr. Ashok. What other remedy other than cure for chemotherapy side effects, if you want to tell?
See, depending upon the symptoms of the side effects of chemotherapy, because the different chemotherapeutic medicines, they give different side effects. Not only that, the different organs of the body, suppose breast cancer, stomach cancer, uterine cancer, if we take any chemotherapeutic medicines, the patient only will decide. The patient only will decide that these are the indications, these are because of my allopathic medicines. Those indications physician has to note down. Okay, we have to prescribe every time on the indications only. We don't have any other fixed tool that every time you cannot give any particular medicine like in Naxomica. If there is severe nausea, then we can think of Ipecac or Arsenicum album or other medicines. But we have to find those indications for any medicine. I do not have anything specific to tell you people, but those are the only indications. That's what Dr. Honeyman has repeatedly asking us. Give the homeopathic medicine to the patient, the most homeopathic medicine to the patient. He is using word most homeopathic medicine to the case. Most homeopathic means most similar medicine to the case. In every case, you need to ask the patient, like in first case of cancer, I have, went back to his, even his past, so back to his past. From that past, I kept on choosing the symptoms of the patient, then I prescribed over those symptoms. This is little hard work we have to do in such cases. Yes,
Thank
please.
you so much, sir. Yes, Doctor, this webinar is live at YouTube also, so you can watch this recording anytime on Homeopathic 360 YouTube channel. We have made it public. For any queries, if you don't find the recording, you can mail me at webinar@homeopathy360.com. I'll send you the link. So after this webinar, yes, sir.
There is one chat of Dr. Durgesh Singh ji. He is very right. He says that, sir, as per law of repetition of medicine should be stopped after getting this sign of cure. It should be switched to placebo. That's what Dr. Durgesh, I have told you, in those cases where the patient is verge of cure, you should stop the medicine or you should increase the interval. If you stop the medicine and send the patient with placebo, if he comes with any indication or any symptom back, then you can restart the medicine, otherwise you can stop it. But normally in cancer cases, I have never ever seen this coming back of the original symptoms. Most of the times I'm not able to see, but in other cases where the cure has really came up. Another thing is, if you are little more, vigilant, if you are more vigilant regarding the repetition of the medicine of LM potencies, then you may not get this observation also. Dr. Honeyman says that getting observation is not good for any physician, this kind of aggravation, because if we are very much vigilant, if we are already giving the gap to the repetition of the medicines, then we may miss this observation, because this observation is homeopathic, so-called homeopathic aggravation is the cumulative effect of the repeated LM potencies. If you keep on giving the medicine at longer intervals, maybe you cannot see this observation. But yes, if you get this, you should stop this medicine. You are right, Durgesh ji. Yes, please. Over to Yashika.
Thank you, sir. When to increase the LM potency like you did as in first?
See, in LM potencies, Dr. Honeyman says into 48 aphorism that if patient is coming up with improvement, and that improvement is slow improving is there, then you can keep on ascending the potencies, right? If you, for example, if you prescribed phosphorus 0/1, patient is reporting you that, sir, I am improving. Then if the same set of symptoms are there, even patient is improving. This is contrary to what Dr. Honeyman says in 5th edition, that you should not repeat the dose or potency. But in 6th edition, he has changed it. He says that in that case, you keep on increasing the potency every time. But in those cases where you get very strikingly increasing, a remarkable amelioration of patients' complaints, you should not give the medicine further. You should stop it. You should not repeat the dose. This is what 246 aphorism first line says. Yes, please.
I think, sir, we covered all the questions and people enjoyed the session. We can, any other queries left, so you can mail me at webinar@homeopathy360.com. And thank you so much, sir, for such a wonderful presentation once again. On behalf of BJN and Homeopathy 360, I want to thank you.
Thank you very much, Dr. Yashika. Thank you very
I was
much.
waiting for such a session because we were something new and something pathological discussion and such critical cases, how we can handle this was actually required. So thank you so much, sir.
Thank you very much. Thank you very much. Thank you.
Thank you. So I just want to thank audience for being with us for today, and we have a webinar tomorrow also. Starting, we are starting the series of with RBTS Homeopathic Medical College tomorrow. So we can continue. You are requested to visit the website and register for the same. That is a 3-day webinar series. And also we are coming up with a PG seminar with CCRH and Homeopathy Science Congress Society, which is in collaboration with CCRH and all PG institutions of India. For all the details, you can visit the website. You'll get all the links to register, or you can mail me at webinar@homeopathy360.com, and you will get all the I'll send you all the details. So thank you so much, everybody, for being with us today. And for the certificates, you are going to get the link in the mail after this webinar. You will get a webinar replay recording mail, all those who have registered. So you will be getting the certificate link in the mail itself, and you can fill the form and you will be getting the certificate for today's webinar. So thank you so much, everyone. I hope you enjoyed the session. We'll be joining tomorrow again. Thank you so much, sir. Thank you.
Thank you very much, Dr. Yashika. Thank you once again, all the audience. Thank you very much. Have a nice time here. Thank you very much. Take care. Bye-bye.